Okay. Good evening, everyone. Thank you all for attending this special meeting of the Alexander Board of Education. I'd like to first start and have Aaron do the roll call.
Mr. Davis?
Here.
Mrs. Edis?
Here.
Mr. Regan?
Here.
Mr. Barnes?
Yes.
And Mr. Collins?
I am here.
All right, if everybody would please rise and we'll say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I need a motion, please, to adopt the agenda.
Second.
Mr. Davis?
Yes.
Mrs. Edis?
Yes.
Mr. Regan?
Yes.
Mr. Barnes?
Yes.
Mr. Collins?
Yes.
Okay, what time, Lindy? You said 7:15 and 7:45 for phone calls? Okay. We are going to talk with our board attorney. There's a couple questions that board members have. She will be available at 7:15. So soon after 7:15, we'll take a quick pause with public participation from the audience to talk to the attorney. And then Mr. Pepper from the health department is somewhere available around 7:45. So we'll have Lindy send a text message and ask Jack to give us a call to hear the latest from him. So to start with, we had so many comments of the YouTube channel last time, and I did a very, very poor job of keeping track of them. It was literally like speed. I can't read to start with, so it was like trying to speed read all these comments. So every time that there was a question, 5 or 6 people would, type in like agree or yes or, and the next thing you know, the question was off the page and I didn't get to it. So knowing the complexity of tonight's meeting and the comments and wanting to hear from everyone, we come up with this procedure tonight so that everybody could have a chance to be heard. So a couple housekeeping things. Number one, Josh, Mr. Collins, he's unable to attend in person for work-related issues. So he is listening to this probably with about a second or two of a delay, and he can't see anyone. So we're going to ask if someone wants to speak publicly that you please come to the podium with the microphone and state your name if you would. So that way Josh can know who's talking. It's going to help him out and facilitate the meeting as best we can. For board members, once the public's participation starts, if we're not talking, please turn our microphone off, because we had some comments about, like, as we shuffle our papers, the microphone picks that up. So again, to help Josh and for those who are watching live at home, it'll make things a little easier for them to hear and understand. Lastly, I've already mentioned it, but the YouTube comments, they are turned off tonight because we sent out the release 2 days ago for having a little bit more orderly question and comment from public participation. So with that being said, is there any public participation for the agenda items of tonight? You gonna let me off that easy? This is the public participation section of the agenda. So this will be the time that we're allowing everyone that wants to say something to say something. And Margaret, I'm sorry for just a second. Mark, I apologize. We have 4 phone calls, correct, on hold? 4. If you would, Margaret, let me take the people that are on hold right now via telephone and let them, because they made the prior arrangements with us to do this. So in fairness to them, so that they can say their statement and then continue watching online, we'll go to them first, if that's okay, Mark. Okay? So we have Krista Reitzel, is that correct?
That's correct, Jay.
Okay. Thank you, Krista.
Thank you. Good evening, everyone. I wanted to thank everyone for the opportunity to participate tonight. I wanted to start by saying, of course, that tonight your decisions and actions will significantly impact the lives of everyone in our school district and community in countless ways. You will make decisions for many individuals who will not be here to speak for themselves tonight and are relying upon you to exercise sound judgment and act in their best interests. There are no one-size-fits-all measures the school district can or should put in place in these circumstances. The plan before you tonight, though lacking in sufficient detail to allow stakeholders to make fully informed decisions, does have 2 strengths that I hope you will leverage to the full advantage of all whose lives this plan will affect. The first strength of this plan is that it is entirely incomplete and unfinished, and therefore presents you with a unique opportunity to more fully consider publicly the feedback, concerns, and questions you've received in order to ensure that they're incorporated into the final plan. This will also help ensure that no members of our school community feel marginalized. If you act tonight with the goal of completing this plan in a manner that minimizes fear of the unknown, unanswered, and unexpected, it will be to the great benefit of all. The second strength inherent in this plan is that it offers some degree of flexibility and choices. However, I encourage you to work diligently this evening to clarify, expand upon, and maximize those choices available to the students, families, and employees in our district. Offering viable choices and alternatives will increase engagement and decrease feelings of fear, discord, and marginalization. On that note, I do want to say a few words in support of our school employees. Except for first responders, members of our armed forces, I can think of few other public servants as dedicated and selfless as the employees of our school district. I urge you tonight to act on their behalf in the most responsible manner. There's only one option that can be put in place that will adequately protect our highly regarded and deeply valued staff, who we rely upon to educate and care for our children. I have every confidence in our district staff to deliver the best remote learning opportunities any child in our county could possibly receive. If our employees are not fully and unquestionably protected, then none of our students can be guaranteed the education they deserve. We're a community, and we must look out for and support and serve one another in all possible ways. Coretta Scott King said, "The greatness of a community is most accurately measured by the compassionate action of its members." I ask everyone tonight to act with regard in the highest manner possible for the concerns of all of our district employees. And with that, I do have one question that I would like to ask the board to answer tonight, and that is how, when, by whom, and under what circumstances will it be decided that the district would transition from in-person to remote learning, and what notification and time frame will be provided to families and employees in the district. And that's all I have. Thank you.
Krista, thank you. Mrs. Douglas, would you want to address how we would make that transition, or to go from attending school to deciding remote? Krista, that is your question, correct? Is how we would make that decision?
Yes, I guess, right. And specifically with regard to the different alert levels, orange, red, and obviously purple, but specifically with regard to those different alert levels.
Krista, we are working closely with the Athens County Health Department, and the board needs to determine which phase we start, A, B, C, or D. From that point, we work closely with the Athens County Health Department as colors change on the COVID scale. If they see COVID rising in the county, then that is a phone call to the county health department, either Dr. Gaskell or Jack Pepper, along with the board president and myself, and then we will determine when we shift to Plan D. Definitely, if we ever hit purple, yes, we shut down and we don't open until the health department tells us to. But floating between yellow, orange, and red, those are conversations directly with the Athens County Health Department.
And Krista, I had a phone conversation with Mr. Pepper on Monday, and hopefully here soon when we call him, he can shed light so that everyone can hear him say it and not from me. We had this discussion about tying the school plan to the color codes, and I'm not going to say it wasn't a recommendation, but he said it would be better if you had flexibility. For this example, let's say that in all of Athens County, there's an outbreak in one section of the county. All of a sudden over here in our area of the county, we would have 0 cases, but yet, given the concentration of, say, Coolville, I mean, I'm picking on anybody, but just that's the first thing that popped in my mind. We might be red, but over in our area, we have 0 cases. So that was one of the reasons, and as an example of why he didn't recommend tying it to the color code. Things change. That's just the conversation that he and I had on Monday. So that's one of the reasons why you don't see the plan like some other school districts are doing based on color code. It gives us flexibility.
Will any part of our decision making be based upon positive cases in the district, or possibly a maximum number of students or employees being absent from the district due to COVID-like symptoms or actual, positive tests?
I think the easy answer to that is of course or yes, but it is based upon conversations with the health department. As I've had many conversations with people, you're at the governor, for I would say lack of action, has made a retired telephone worker, an accountant, Lucy, a mom, church secretary, treasurer, correct? Yes. You've got a math professor and you've got an engineer. That's who's trying to make the best decision on what to do with Alexander School District and your kids. That's the makeup of your board. Do we know
Well,
the
I
answer? Hold on,
support
wait a
all
minute.
of
Let me
you.
just say this. So to answer your question, though, we are going to take guidance from the health department. So that's why you won't see you might see it, but at least right now, we don't have it color-coded and tied to anything specific.
And I'd like to. There. Krista, this is Lucy. One of the things the board will be talking tonight about is actually whether or not to tie, whether the school buildings are open or not to that code. I have a different, Jay was not speaking for me when he talked about wanting that flexibility. So I believe tonight we'll be talking about, there are good reasons. There are good reasons on all sides, but there are definitely good reasons if we were to think about tying whether or not the school buildings or extracurricular activities are done according to the code.
Terrific. Thank you, Lucy. And thank you, Jay, as well. I think part of the concern is at the last board meeting when Jack Pepper did recommend that the safest way to start school was remotely, I think just as a community member in this district, a parent in this district, I, of course, want to know, has that changed? What is the school doing with that information, and when will we know as parents and teachers, employees, so that we can all make arrangements for ourselves, our families, and with child care providers or whoever else we may need to make those arrangements with. So that's all. You don't have to answer that necessarily right now. That was just, I know, a concern.
Thank you, Krista.
Thank you, guys.
It's 20 after, so can we pause for just a second? To the three remaining on hold, we have a small window to hear from our attorney, Beverly Meyer, with Brooker and Eckler. There's a couple questions that I know the board wanted to hear her answer to specifically, so if we could get her on the line, please. And then we'll get back in. I think, Katie, you're on deck if you're listening.
Sorry about that. Here we go.
Okay.
Hi, Beverly.
Hi, how are you doing?
Good. Thanks for taking the time to join us at our board meeting. So to expedite things, we do have a couple of member questions. I'm not sure how well you're going to hear, so if you can't hear them, I'll try to relay the questions.
All right.
Okay. Who wants to go first?
Hi, Beverly. Blake Regan, how are you?
Blake has a question, Beverly.
Okay, there is a bit of an echo, so you'll probably have to relay it.
Go ahead.
Beverly, I just had a question about the school liability relation to COVID and opening or not opening. If you can shine some light on that.
Certainly. So the exact answer is uncertain. However, I can tell you that there is statutory immunity pursuant to Ohio Revised Code Chapter 2744, and that generally protects school districts from negligence in the provision of a governmental function, which would be the provision of education. There's also in the works, House Bill 606. It has been passed by the Ohio Senate. It will be returned to Ohio's House for a concurrence vote that's expected to happen in September. And that House Bill 606 provides businesses and persons immunity from claims that are related to COVID. And under the definitions of that House Bill 606, a school would be a person immune from suit or claims related to COVID. And then as it relates to employees of the district, there are also workers' compensation laws that require employee claims to revert to the workers' compensation system. So that's a general summary of it. The insurance companies are also issuing opinions about coverage, and I'm not certain whether your insurer has done that, but I would encourage the district to consider getting an opinion from the insurer if it has not done so already.
Is there anything that affects that liability in the House Bill 606 or anything like that?
So long as, oops, I got some feedback there. So long as the conduct is not adjudged to be willful, wanton, or reckless, there should be immunity intact. Now, what that means in operation is as yet undefined, but the supposition, which again has yet to be legally tested, is that compliance with what the CDC and ODH and state and federal orders are would protect an entity.
Okay. Thank you.
You're welcome.
I'm going to walk you down to Lucy.
There. Can you describe the difference between activities that would require a waiver and activities that would not require a waiver?
That is an excellent, oops, I'm getting a lot of feedback, I'm sorry. That is an excellent question. Technically, there are no activities that would require a waiver in relation to the pandemic. However, there are some activities that it would be advisable for districts to obtain waivers, and those are along the lines of what I call discretionary activities, ones that are not compulsory education. There is some question out there as to whether you can, as an educational entity, require a student to waive liability or claims in relation to their compulsory attendance in a physical school building. However, that is just discussion and supposition. It has not been legally determined.
Is there anything else we should know about the difference between those two?
Not that's coming to mind right now.
Okay, thank you.
You're welcome.
Josh, do you have any questions that you'd like to ask Beverly?
Yeah, sure, given the chance. I guess there is one thing that I'd like to be clarified. And Aaron may be the best one to parlay this question if Beverly can't hear me well, but I had asked in between the last meeting and this one for Aaron to go back and clarify exactly what it was that we voted on. And what we have in front of us tonight is different than what we've voted on. And I want to make sure that we are, one, in the clear, or two, what it is we need to do to get back on track. I mean, basically, is there enough change that it invalidated what we did before?
Did you hear any of that, Beverly?
I could not hear that. Could you please repeat that for me?
We voted, and then I can almost tell you what your answer is going to be, but I'll ask it anyway. the last 2 weeks ago, when we had our meeting, we voted to basically open school blended. Or we voted to come up with a plan to go blended. So the way that it all transitioned and all the feedback over the last 2 weeks, we've got board members that are questioning what we actually voted on. Did we vote on, yes, we're sending the children back on a blended schedule, or did we just vote to have admin come up with a blended schedule? I think that's what Josh is asking. Is that correct, Josh?
That captures the majority of it. The specifics of it, and you know how I think, Jay, I want to make sure that we are on the right page before we ever get started off on the wrong one. We had specifics tied to how we were going to open. Those specifics are different than what we have now, as well as even some of the options are different. So I want to know, are things differently enough that if we approve this plan, we have boogered with what we did before? And do we need to go ahead and reset where we are before we go forward with it? Aaron, help me. You understand the question. You were the one that looked it up and replied to us all. If I'm not being clear, I need your help.
I think you're being clear. I'm not sure if the others are clear. The issue or whatever, however you want to phrase it, when people were voting for what it was you were approving last week, it seemed like each person would specify, well, I want to be clear, I'm only approving this, or I'm only voting for this. So the only thing that I could take from what happened at the last meeting was, at that point in time, as of that date, the board was authorizing the district to begin the first 9 weeks with the blended learning 2 days a week and 2 days with the other kids. But I think it was also made pretty clear that that could be changed at any time at the discretion of the board. So it's kind of pretty open-ended from that standpoint.
Okay, Beverly, not to keep you hanging, so Josh had asked if you could shed any light on it, but you haven't read our motion, or you haven't read our minutes, have you?
I have not.
Okay.
And that's where you would turn to determine what the board actually voted on.
Okay, so you're not prepared to give an opinion on that on the spot?
Correct. I would encourage you to talk with your treasurer, Aaron, who is responsible for keeping those minutes. He should be able to provide that information to you as to what the vote actually was.
Okay. Yeah, Aaron just gave a little explanation while you were patiently waiting. So for now,
Hey, Jay.
Go ahead, Josh.
I just wanted to ask you, I know she can't hear me, so please pass on my apology, Beverly. I thought she was up to speed. My bad.
Lucy had a follow-up question, Beverly.
Okay.
It's a follow-up to it's part of what we were just talking about. I do want to say that it was my impression when we voted last time that we were telling staff, come up with a plan, and that we would be approving or not approving the plan at this meeting. It was not my impression. It was my impression that in approving the final plan, we were approving how we would start, because there was no way I would approve opening school 2 to 3 without seeing a detailed plan. So my impression is different than Aaron's.
Okay.
Let's let Beverly go.
Yeah, I was gonna say, so
we need to move this to the
yeah, we need to
discussion part.
move. We need to move on. I agree, Josh, and not take Beverly's valuable time. So, Is there anyone else that has a specific question that Beverly can answer at this time? Fred, you good? I'm good. Okay. Josh? You good?
Yeah, I'm good. I apologize for opening that can of worms.
Okay. Beverly, that's all we had. I appreciate your time.
Oh, I'm happy to be of help, and it was nice talking to you all. Thank you.
Have a good night.
You too. Bye-bye.
Okay, Mark, let's go to Katie, please.
Hello. My name is Katie Thompson, and I teach at Alexander Elementary. I am speaking on behalf of my third grade team today in regards to our district's plan to return to school next month. I want to start off with a statement by the Ohio Education Association that was made on July 28th. They said, under Ohio's warning system, OEA believes that any school or campus building located in a county designated as level 4, purple, or level 3, red, must remain closed to in-person instruction. Until a vaccine or cure for COVID-19 is widely available, schools in all counties, including level 2, orange, and level 1, yellow, must be permitted to open for in-person instruction only if all CDC requirements can be fully met, which I know you guys just addressed that. And I just want to touch briefly on, I know that we are currently at a level orange, which is a step down from where we've been the past 2 weeks. But when OU students return to campus, many officials believe that we will see another spike, most likely moving us back to either red or purple right before our students are supposed to return to school. With that being said, here are some thoughts that my team and I share. As teachers, we are scared. We are listening to the scientists and medical professionals who know the most about this virus, and we are scared. We are seeing that Major League Baseball teams, which are full of adults with almost infinite resources and unlimited testing, are seeing huge outbreaks of this virus, and we're wondering how our underfunded school in a county with limited testing available will compare when hundreds of students enter our building in just a few short weeks. Yes, we know that precautions are being put into place, and you guys have worked on great plans for that. But if you've ever been in the elementary, you should be well aware that getting all students to follow all the rules and expectations all the time just doesn't happen. If you speak with any teacher in our district, they will probably tell you they agree that in-person instruction is definitely more effective than remote learning. We all desperately want to return to normal. However, due to current circumstances, 66% of our teachers do not feel safe returning to in-person instruction. With over half of our teachers either being high risk or having someone in their family who is high risk, returning to school in a few weeks will be putting people's lives in danger. So my question is, whose life are we willing to risk? Is it the older teachers who are automatically high risk due to their age? Is it the teachers with other illnesses that make them high risk, which could cause extreme complications or death if they contract COVID-19? Or maybe it's us young teachers who would only experience minor symptoms or be asymptomatic, but then take the virus back to our young children at home or the parents, grandparents they provide care for. Is it our young students who we used to think wouldn't see many effects from COVID, but are now dying in states like Florida when they have no underlying medical conditions? The answer should be none of these. We shouldn't be willing to put anyone's life in unnecessary danger just so that we can get back to, quote, normal. Are parents and administration aware of what normal will even look like? My third graders will be sitting at a desk or on the floor right next to their desk, working on a computer for most of the day. They won't be moving around the room, working with their friends, using our items in the classroom as normal. At lunch, we've been told that all students will be facing in one direction and seated 6 feet apart. That sounds like fun, right? Special teachers will be coming to our classrooms and doing their best to provide valuable lessons with less materials, less options, and let's be honest, less fun. Going back to school will not feel normal to students. Nothing about this will be normal. We can protect all of our staff and students by following the guidance of our local health department and going fully remote to start the year. And I hope that our board will reconsider their decision tonight. None of the options are ideal right now, but at least this one has less of a chance of ending with a funeral for someone in our district. Thank you. That's all I have.
Thank you, Katie. We have Judge Stewart is our next caller. Judge Stewart?
Yes, thank you. My name is Bob Stewart, and I'm Athens County's juvenile court judge. For those who don't know me, I've been an attorney in town for years and part of the juvenile court system for the last 40 years. I've represented children, represented parents, served as the magistrate, and I've been the judge for the last 18 years. In juvenile court, we handle cases of abused and neglected children, delinquent and unruly children, and assist with parenting arrangements for children who are born outside of marriage. In short, we are a child-focused court. I've looked at Ohio's guidance on reset and restart for the opening of schools. I've tried to follow the announcements and media coverage for all 5 of the K through 12 districts here in the county. I just want to share some thoughts and observations from experience. I don't have anything earth-shattering to share, but sometimes when we assume people understand certain things, we've not made a smart assumption. So let me just start with these remarks. I'm concerned that we might be seeing only one evil and ignoring the many evils around us. By that I mean the concerns with this virus may be blinding us from very real concerns about the overall health and well-being of our children and their families. Whatever the plans you come up with to reopen, they will not be perfect, nor should we expect them to be. You will not be able to guarantee anybody any specific results. And we fully understand that. That's not expected of you. All we can ever do is use our very best efforts to accomplish the best overall goals. We should remember that there is a huge element of personal responsibility and individualized planning in a situation like this. Households with a child or a primary caregiver with medical issues likely to result in serious complications if they should get the infection should certainly opt for options that keep them out of the fray. But the fact is, so many children benefit in so many ways from our schools and our classrooms being open. There's very little data right now suggesting that children are at risk. And I think that's something you might want to bring up with Jack Pepper when he speaks later. Classrooms and laboratories are certainly the preferred method of delivering education and will remain that way for some time. Many families will struggle to make arrangements for their child care, educational guidance, and if they're forced to do all their education from home. We all know and understand that children need and clearly benefit from structure, schedules, consistency, and appropriate discipline. Sadly, for many of our youth, there's not much positive role modeling going on outside of the school setting. Further, teachers and other school personnel are regularly among the first to spot important issues ranging from personal hygiene, malnutrition, dental and optical neglect, drug and alcohol use, and child abuse. In fact, our teachers and school personnel are not just trusted resources, they are mandated reporters. Also, we need to remember that Ohio mandates classroom participation and attendance for our children, and there are criminal penalties for parents who do not comply. That's how important we believe their presence in the classroom is. Behavioral and mental health issues are frequently identified at school, leading to professionally networked services, often right in the school building. Schools provide appropriate guided social development, as opposed to children who may be in isolation or exposed to abuse, exploitation, or domestic violence. Schools also oversee our food and nutrition programs, where we can actually observe the youth getting at least 2 appropriately planned meals a day versus hoping that drop boxes end up being used as intended. For those reasons, I would suggest that we make every effort to find a timely way to open our schools and our classrooms. Thank you.
Thank you, Mr. Stewart. And last, we have Maggie Reitzel, who would like to address us.
Hi, my name is Maggie Reitzel. I am going into 8th grade at Alexander. I have hearing loss and juvenile arthritis, both due to viruses. My immune system is compromised, and I and my grandparents are high risk. I have many concerns about returning to school, not just for myself, but for others too. Some of my concerns are, how do we return to school safely? Are we prepared to deal with the consequences of in-person schooling? How will we sanitize everything and anything? Unfortunately, it's inevitable that someone will get sick. What do we do then? I really want to come back, and I'm really looking forward to my 8th grade year, but I don't want to put my friends, family, and teachers at risk. How can we focus on school when we are fearing for our friends, family, and teachers? How do we return to school safely without having to fear for our lives? How are teachers supposed to teach when they are scared? I don't think taking these chances is worth the known risks to our school district and community. Thank you for your time and consideration.
Maggie, thank you. I can speak personally. I know that the board as well. We received a few emails from our students, and I think that speaks volumes to the courage that it takes to talk to a bunch of gray hairs up here. Sorry, Blake, you're bald. But anyway, but the fact that we got at least 2 high school students, and Maggie, you said you're going into 8th grade. It
Yes.
demonstrates a lot of courage, and I thank you, and to the people or the students that sent us those emails, thank you for taking the time to address us. We truly value that input.
Thank you.
you.
Okay, thank you, Maggie. Okay, Mark, that's all we have that wanted to address us remotely. Okay, so now I would open it up to the audience again. Oh, I'm sorry. Yes, sorry, Mark. We'll get there. Yes, it's a quarter till, so we're going to try to get a hold of Mr. Pepper and hear what he has to say as of today.
Okay, we're good.
Jack, Jay Barnes, thanks for taking the time out to answer our questions. We truly appreciate. So I'm going to turn it loose here. I know that we have great distance between us sitting here at the board, so I'm just going to hand the phone around, and they're going to hold the phone to the microphone so that the audience can hear what you have to say.
I wish it was different circumstances. I appreciate the effort you're going to.
Okay, I'm going to hand the phone to Mr. Regan. Blake, he has, I think he has a question for you.
which side you had it
You
there,
just
right?
talked into it.
Hi, Jack. Blake Regan, how are you?
I'm well. How about you?
Good, good. I guess before I ask a question, is there any general statement that you personally you feel to clarify from our last conversation a couple weeks ago, whether or not you remember that?
Honestly, I've talked to so many different school boards and groups and organizations and businesses that it's all kind of running together. So I don't remember the specifics, but I can tell you that the public health lens hasn't changed. In terms of the CDC guidance and the safest way to return to schools in the fall. We've not made any public recommendations as a health department because we feel like, those recommendations are reserved for the superintendents and then the school boards. Clearly we transitioned from red to orange today, which was great news. I think we sort of anticipated that happening, based on what we were able to derive from the July 4th weekend and then the subsequent spike in cases that we saw. And we're still all sort of waiting for Ohio University to make a decision about what their return to school in the fall is going to look like, which I think we all know will have a significant impact on our local community. So nothing that that I talked about a couple of weeks ago, do I think has changed, other than our speculation on a decrease in cases is in fact what has happened. And we're of course hoping and anticipating that trend continues.
Okay. Then I'll ask two main questions for myself, I should say. My first question is just to clarify that your recommendation was not to start online. It's simply the safest for the spread of the virus.
That is correct. Is that the CDC still to this day has posted on their website that the lowest risk return to school would be in a virtual environment, but that's not to say that there aren't other things to consider, and that is what will work for all districts. But if you're talking about the safest way, the way to limit the spread of disease, a virtual platform or virtual modality would be the lowest risk to return to school in the fall.
Okay. And then secondly, just because I had received some, whatever you want to say, contact from people about a statement about exposure and everybody within, if there was a positive test, whether it be a student or a teacher, what would be considered the close contact and being forced quarantined.
Right. So basically, let me paraphrase to make sure I'm understanding you. The question is, what does quarantine look like in a classroom environment?
More of what does the definition of exposure and close contact look like in our school?
Okay. Yep. So that's actually pretty easy. The CDC has maintained for some time now that a close contact is defined as somebody that is 6 feet or closer at a duration of 15 minutes or longer. However, there is an asterisk that's now attached to that statement that indicates that duration and proximity should be a consideration when making assessments on a case-by-case scenario. And basically what that means is that it would be naive to believe that, if I was 6 feet 6 inches from you for 7 hours, that wouldn't have an impact on the likelihood of whether or not you became ill. So that's what that duration and proximity piece looks like. So the position that we're taking at our office is that we're steadfast, and Dr. Gaskell, who is our medical director / health commissioner, is certainly also on board and ultimately will make many of these decisions. we're going to evaluate each scenario on a case-by-case scenario, using that definition of 6 feet or closer and 15 minutes, knowing that in a select few circumstances, depending on the situation, there may be others that are quarantined depending on that duration and proximity piece. But as a general rule, it's that 6 foot, 15 minutes.
I think I know the answer to this, but I'm going to put you on the spot. What about an hour, 6 feet apart, 6 foot, 6 inches apart in a desk with a mask on, socially distant, listening to my teacher and doing my homework?
So that's a great question, and I appreciate trying to drill down to some of those specifics. But there are just so many different scenarios that could play into that. Are you requiring facial coverings or not? Is the kid coughing a lot? What does that exposure look like? Was there a lot of interaction between the students or a staff person? There are so many details that could go into that it would be impossible for me to speculate right now what that will look like. But what I can tell you is that with certainty, those would be the scenarios that would be evaluated on a case-by-case scenario for that duration and proximity piece.
All right. Well, that was a better answer than I thought I was going to. Anybody else? I'm going to walk you down.
Hi, Mr. Pepper. This is Lucy Edis. How are you?
I'm well.
Is it, you can hear? Okay. Last time we met, Athens was in red with a star on it, almost purple. How long was Athens in the red, Athens County?
Approximately 2 weeks. So we saw a really significant decline in almost all of the metrics that they measure over about a 2 to 3 week time period. And to be perfectly honest, the metrics that they measure are headed in such a good direction, and are currently the way that our cases are coming in. I would be lying if I said that I didn't think that there was a possibility. Now, I don't know this for certain, but I certainly think that there's a possibility we could end up transitioning back to yellow. Keep in mind, though, that depending on what happens in the fall here, that we could transition quickly back into red or even that purple watch list, which happened quickly here in Athens. I've said this already once publicly, and I just feel that it's important to reiterate that the way that the state is measuring our numbers is based on our total population, and we know right now that a significant number of that is missing. And if it arrives here in the fall, it will play a significant role in what happens to us in terms of our color coding and that alert system.
Okay. And when we went red, was that because why do you think that was?
Well, there are 7 metrics that they use to measure that, and many of those metrics, it's all data that they can measure. It's all data that the state has access to, and they actually just today made that data available on their website. So if you go to the coronavirus.ohio.gov website, you can actually see the metrics that they're using and the data that's specific to Athens County.
Okay. Okay. I guess I should have asked, was it because OU student athletes came back?
Well, I mean, I can't, that's a HIPAA violation, so I can't tell you that specific. But what I can tell you is that during that timeline, 88% of our cases were in the age demographic of 20 to 29. And so I think it you can make the deduction on your own, I think, is to which age demographic and whom to which group they belonged was accounting for a large segment of our positive cases, 88%.
And do you know the average number of students that were called back to OU at that time?
I don't have any idea.
Okay.
I know that, I mean, anecdotally, I know that July 4th weekend, which seems to be where a lot of these cases stem from, was a very busy weekend in Athens.
Okay.
But I only have anecdotal evidence to support that. I don't have any hard numbers. There are a large number of Ohio University students and Hocking College students that have rentals. They've signed leases and they can come and go as they please over the course of the summer.
Yes. What about the testing availability right now? How long before someone is designated having been a close contact or exposed to when they can actually go and get a test here in Athens County? What's the average?
Right. So testing is available. There are many resources that are out there. You can go to our website, which is athenspublichealth.org, and there's a testing document on there that gives it's updated almost on a daily basis as to who's doing what kind of testing and how it's available. If you are a close contact or feel like you've been exposed or you have symptoms, testing is available here in Athens County. The testing that's really challenging is no cost, no symptom testing. And we're working very hard at the health department to try to remedy that situation. But it's not as easily executed as we would hope for.
Okay. I've read this on people's experience on Facebook in an Amesville group, that some people who try, and this was their own experience, not someone else's, that it was basically 7 days approximately between when they were exposed, possibly exposed, to when they got their test results back at the same time we were having our board meeting last time. So a couple weeks ago. Does that seem like that might be accurate?
Are you asking about the duration at which they get tested to when they receive the results?
No, when they had their official exposure to when they got the actual results. Several people said that it took them a couple days they were exposed, then a couple days later they got the notification, then they tried to go in. It took them a while to get an appointment to see a doctor, 2 to 3 days, and it took them 2 to 3 days to get an appointment or to actually get in and get a test in.
Yeah. So I think that folks that are totally unaware that they may have been exposed. So for example, someone who didn't travel to a hotspot, or someone that perhaps knew somebody, like, oh, I had a friend and we were at the same location and now I'm worried. I would say that it is fairly accurate. It would be a reasonable assessment that from the time that they were exposed until a week later before they've made contact with our office, I don't think that's unreasonable. It's unfortunate, and it's not something that we're particularly happy about as public health. I mean, the quicker that we can get people quarantined and isolated, the safer we can make the community. So that expeditious process is really important and critical in preventing the spread of disease. It just again, because of the way the disease operates, not everybody gets very sick. We're trying to make people aware of some of those mild symptoms. If you think you get sick, we have some documentation on our website that tells you what you should do. But it wouldn't be unreasonable to think that it could be a week from your exposure until you were in quarantine or isolation, just because of getting the appointment, getting the test done, getting the results, and then the results getting to us. It is not as efficient as we would like it to be.
Okay. And what happens in your office? What's the difference between how slammed you are when we're red and how slammed you might be when we're purple?
Okay. So honestly, there really is no difference. We're still very busy right now, even though we don't have a lot of cases come in because we're still having to follow up with all of our, close contacts and those that are on quarantine and isolation from whatever disease that we may have maybe around. I can tell you that if we reach red and purple, the trend will be exponential enough. So, for example, that week in July, our cases increased by 700% in 7 days. If we get into a scenario like that, we will be very busy at our office, regardless of whether we're red or purple. We have made arrangements and have agreements with some additional resources. We actually can double our contact tracing capacity overnight right now. And so we're really proud of that. That's a new partnership that we've got with Ohio University, and so we're really excited about that. So we feel better prepared to manage some of those circumstances, but red or purple, we will be very busy.
Okay. Last question. There's more and more scientific evidence that there's aerosolization going on. What's your take about that?
Well, that honestly is a really good question for Dr. Gaskell. I mean, he's the medical professional. But what I can agree with is that I too am seeing those articles, and all it does is really confirm what we already thought, which is aerosolization confirms person-to-person transmission more than it does person hard surface transmission. So initially, in the early onset of the pandemic, there was a lot of concern around hard surfaces, and we're still very concerned about that. But Dr. Gaskell has commented, and I think that the science is starting to support that this is a disease that spread from person to person through aerosolization. Not perhaps at quite as much as person to surface transmission.
Oh, one last question. What's the difference between what you do and what Dr. Gaskell does?
So Dr. Gaskell is the medical director. Every health department is required to have a physician to make medical decisions for the office. There are a bunch of different models that you can use in Ohio. Typically in rural counties, they use the model that we use, where the administrator runs the day-to-day operations of the health department, and the medical director is then there for consultation on medical issues, because I am not as classically trained as he is as a physician to make some of the medical assessments that need to happen at the health department.
So he's the doctor and you're the administrator.
You got it.
Okay. Anyone else? Thank you. Thank you.
Jack, this is Jay. I think I'm going to be the last one, and then we'll let you go.
Think again.
Oh, I'm sorry. Okay. I'm going to actually, Jack, let Josh speak. I forgot. He's on Zoom, and it's one of those out of sight, out of mind. So my apologies. Go ahead, Josh.
You wish you could get rid of me that easily. I may need just to relay them, if you will, Jay, since we had trouble with Beverly communicating. I'm wondering if Jack can be specific about the PPE that's required that we need to supply when we are dealing with someone who's suspected to have COVID.
Hey guys, I can't hear anything he's
Yep,
saying, so
I'm going
have to do some interpretation.
Yep, I'm going to relay Josh's question, because again, he's remote. So his question was, can you elaborate on what kind of PPE is required for this, and the amount required to open the schools?
Specifically for people that are dealing with the suspected COVID case.
By any governing body for PPE, there are only recommendations, and we have publicly made the strong recommendation that anyone in grades 3 through 12 and staff be required to wear, facial covering. And that actually aligns with what the Ohio Department of Education and the Ohio Department of Health have pushed out. We don't discourage K through 2 If you can pull it off, that's great. But we recognize the challenges that could be associated with trying to keep 5, 6, 7, and 8-year-olds in a mask for a full day. So K through 2. We don't discourage the use of facial coverings, but it's not a part of our strong recommendation. 3 through 12, we strongly recommend the use of facial coverings.
I'm thinking, Jay, if you could ask a follow-up, the specific for our clinic staff, anyone that's going to be in there and have to deal with someone that's suspected to have COVID, what do we need to supply them?
Okay, Jack, Josh, follow-up question is now specifically related to our clinic staff. What requirements do we have to supply them, or what requirements do we have to meet in regards to COVID for our clinic staff?
In terms of PPE?
Yes.
Again, there is no requirement. That would be up to the district and a conversation with your staff. I would think that you would want them in as much PPE as you could put them in an effort to keep them around. The clinic staff is going to be hugely important for districts this fall. Y'all are actually very fortunate to have clinic staff. Some of our districts don't. Because those are going to be the frontline individuals dealing with, sick kids every day, sick staff even. So, we would, of course, I can tell you what we do at our office right now when our nursing staff interacts with the public. And that is a face shield in conjunction with a surgical mask. And if an N95 mask is available, that's our preference for our staff.
I have another one, Jay. He mentioned just a moment ago, and it triggered in my mind. He mentioned kind of the difference in training that he and Dr. Gaskell have. And, Dr. Gaskell is kind of he's accredited or has the right training to do a certain kind of assessment, and Jack does not. What assessment ability or what credentials do we need to have in our staff to be able to do COVID assessment in order to do that screening to say, that looks like flu, that looks like COVID?
Okay, Jack, another question Josh has is for our clinic staff. Is that correct, Josh?
I'm assuming it's going to have to be limited to clinic staff because I doubt that we'll have teachers looking at a kid in the classroom and saying that's COVID and that's flu.
Okay, so Jack, question is what type of training does our clinic staff need to have to make that determination? Oh, this looks like COVID, this looks like the flu, this looks like normal stomach ache, things like that.
Yep. So all of that guidance is on the CDC website. I'm happy to provide it for you guys. But it really does. It's really challenging, and the disease is actually mimics many typical diseases, which is what's going to make those assessments, so very difficult. And what we can do is once the district makes a decision, the board makes a decision in terms of what they are going to do in terms of the modality of which they're going to go back in the fall, which platform that is. We're happy as the health department to work out some of the intricacies of that plan with you all in terms of being able to identify which symptoms they need to be looking for, and then the appropriate actions that should be taken, based on what symptoms they're seeing. Right now the CDC guidance is pretty clear, that if you believe that you have any of the symptoms that mimic COVID-19, that you should isolate yourself from people until otherwise.
Josh, you good?
Sorry, I was chewing on that one for a moment.
Okay.
The last one I have for Jack is if he could help us with, he made a statement at the Fed Hawk School Board meeting. They mentioned they were planning to bus 2 to a seat, and I believe he said that is outside of CDC guidelines, and they would definitely not be in favor of that. We currently have that in our plan, so I'd like to know if he could confirm that I heard him correctly, and then what his recommendation would be to get us back into compliance.
Jack, Blake, another question, I think, and he's basing it on what you had mentioned to Fed Hawk in their board meeting regarding busing.
Yep.
Can you address what the recommendations are today for busing?
The last that I checked, it was it had not changed, and that was 1 kid per seat on the bus facing forward. They actually prefer that you alternate seats. Clearly we recognize that that's not doable. Of course, people that are in family units, they can sit together. So brother and sister from the same family unit could sit in the same seat. But that is strictly a best practice recommendation. It's not a requirement.
So would they then be okay with us 2 to a seat?
So Jack, would you be okay, like say, approving a plan that would have 2 kids to a seat?
We've actually already approved plans that look like that. I mean, it is a recommendation, and if the district logistically can't make it happen, then we've already signed off on plans that have kids that can't, they physically can't do it. It would be such a disruption to their school day that there's just no possible way they could bus that many kids around.
Okay.
Just to let you know, working on the plan with the busing department, if we run Plan B, and correct me if I'm wrong, Dan Phillips, but we talked about if we run Plan B, we can get 2 to a seat, and families can sit together. If we run Plan C, Dan feels we will have 1 to a seat and families sitting together. So if we're on C, we should be able to accommodate the 1 to a seat.
And what about school athletic buses? 1 to a seat or 2 to a seat? Okay, thank you.
And that will get
Translation, please.
tricky.
What was that,
I couldn't
Josh?
hear a single bit of that. I couldn't hear a bit of that. Could you translate what was said, please?
Yeah, I think, Brian, is that you back there? Okay, I can't tell from masks. So Brian had mentioned, Dan's not here, that the plan can work if we go with option C, which is the blended 2 and 2. We can do 1 child per seat. If we go with Plan B, which is the 4-day-a-week option, then we can do 2 per seat. And then Lucy had asked about athletics, and football has requested 2 buses so that they can do 1 player per seat. So yes, sports is also coming into play, 1 per seat on busing.
Sure. And I think it's appropriate that if you can make those accommodations, that those of course would be the health department's preferences.
Okay. Josh?
I don't have any more, Jay. Thank you.
You're good, Josh? Is that correct?
Yes, I'm good. I don't have any more.
Okay.
Thanks.
Okay, Jack. I mentioned something earlier in our meeting, and I want you to say what I thought you told me. And we've had a lot of, or I've had a lot of concerns about, well, you know, we're red, and why don't you tie the plan and going back to school to the color codes of the county?
Sure.
And my recollection from our conversation is you said that you would rather not do that to maintain some flexibility based on where the outbreaks are in the county. Is that fair?
That's fair. Our concern is, our concern is that if you tie yourself to that alert system, it could become very disruptive. I mean, you all can do whatever you want. I mean, it is ultimately your decision, and all I'm doing is providing you with data, information, and details. It would be, and there are some districts out there that have tied themselves to that alert system. But if you just look at the last month, if you look at July, we transitioned in July from yellow to orange to red with an asterisk to red and back to orange. And if you tie yourself directly to that system, I mean, that could be an extraordinarily disruptive pattern for your kids. So for example, and again, this is just a theoretical scenario, but if you chose to go full, let's just say you chose 5 days a week on yellow, okay? So the first week of July, you would have been in school 5 days a week. And then when you transition to orange, you go to a 4-day model. So now a week later, you're transitioning to 4 days plus a virtual day. And then if you went to red, let's just say that was the blended 2 days on, 2 days off. You've now in the third week transitioned to that red. And if you were to have chosen, if we had gotten to purple, a full closure, you could have been, at a closure. And then here we are, the last week in July back to orange, and we've now transitioned back into yet another modality. So does that make sense, Jay? I mean, does that?
It does to me. I just wanted I wanted the public to hear your comments
Right.
on it.
So that is, we're of course not education specialists at the health department, but to us that seems like a very challenging scenario to try to implement. It seems like it would be extraordinarily disruptive. And honestly, we've asked the governor to consider not making the change on a weekly basis to try to, for this exact reason. And at this point, the governor's office doesn't have any interest in making a change to the frequency with which they evaluate the transition between the different alerts within the state.
Okay. Mr. Regan actually whispered this question to me. Is it possible to get those metrics that you mentioned for the color coding based on school district to school district?
We're working on that. So basically what he's asking for is zip code data. And we're working on that, and I think that will be a possibility.
Okay. Looks good. Okay. All right. I have the phone, Jack, but Lucy has a follow-up question. I'll relay it.
It's just, is there a difference? So, a clarifying question. If someone gets sick, or if someone comes into contact with someone who has COVID, and the color is red, and if someone comes into contact with someone who has COVID, and the county color is purple, will that person get their test results in the exact same time, whether it's red or purple? I'm worried about the health department getting slammed and someone from our district getting sick and then getting stuck in the big hullabaloo problem of everyone getting tested at once, and they have to wait 14 days instead of 7. Is there a difference in service?
So I'm going to try to summarize, Jack.
I heard the question.
Okay,
I heard
good.
it, so I think I can answer it. I can save you the trouble.
Good.
So the answer to that question is unless you end up in the ER, because right now the ER in Athens County is about the only place that you can get an expedited test. The answer to that question is no, is that there is no preference given currently to, there's actually no tying to the color coding system at all right now. But in addition, moving forward, that if we're in a circumstance that mimics early July, where we were seeing a lot of cases, there is no priority given to any particular individual, based on need or on significance. It's not designed that way, because we're relying on laboratories that are either private in some cases, like LabCorp and Quest, or the Ohio Health System, which can and has become overwhelmed at times. So there is no way to prioritize unless you are actually literally in the hospital, at which point they do have a rapid test, and you would get your results very quickly.
That wasn't my question. It was staff capacity. What's their staff capacity at the red level versus the purple level to take in people who are exposed?
At our office, what's our staff capacity?
Yeah.
So we have 19 staff at our health department. We have
You want the
5 people right now that consistently are working case contacts. I have an additional 5 who are trained and at the ready. I have an additional 3 who can do contact tracing only. So instead of being able to do case investigation and case contact, I have an additional 3. And then we also have 12 folks that are on campus who are now trained and ready to do contact tracing. And in addition to all of that, the Ohio Department of Health has a strike team that we can request. They don't have to honor the request, but they do have a strike team that we can request in the event that we become overwhelmed to assist with contact tracing and case investigation.
Okay, still not it. My worry is that students come back, someone in our community gets sick. There are 50 to 100 students who have to have all of their closest contacts contacted. And that's much different than if we had not had anyone sick when everyone was getting sick there. My worry is, are they going to be able to, they're going to be so overwhelmed by OU. How are they going to be able to help everyone?
Lucy, can you turn on your mic, please?
So
it's really fun to watch the charades.
I don't, I'd like to stay away from who is sick, but I do think that we share your concern, and that in the event that we have a large surge, keeping up and being able to do all of the necessary contact tracing, while we feel like we're well positioned and prepared, it is a legitimate concern because quite frankly, we do only have so many resources at our disposal. And so absolutely, we planned for that, and we've got some mechanisms in place. There are actually more folks on campus who have an interest in helping. But again, that training piece takes a little bit of time to spin up. But we feel like we've positioned ourselves pretty well, that if we are similar to the surge we saw in early July, or even more, within reason, we're prepared to be able to do the follow-up.
Okay, that's good enough.
Okay, Jack. I want to make the point, and again, I'd like the audience to hear you reiterate this point. All along this journey that we've been on, you have fielded, I know probably every board member here has called you at least once You have spoken with our superintendent quite regularly, and you stated it earlier, but I think it's worth stating again that whatever we choose, whatever direction, whatever curveball is thrown at us, you and your department is willing to work with us very closely to try to make the best decision possible.
Absolutely. There's no doubt there. I mean, that is absolutely.
Okay. Is everybody good? I'm going to let Mr. Pepper retire for the evening. Jack, thank you very much, as always, and we'll be in touch as things arise.
Yes, sir. Thanks for having me.
Thank you. Okay, are we good to have the audience now? I haven't forgot anything, have I? Okay. Okay. Margaret, you want to go first?
All right, so my name is Margaret Demko. I'm the parent of a soon-to-be sophomore special ed student. In listening to everything that just happened in the last hour and a half, my mind and my thoughts have kind of went a million different places. I came here to talk about something specific, and now I feel like there's a whole lot more things that have come to my mind. But the first thing I want to ask is about special education, since that's the first thing that comes near and dear for me. When we got the plan and we need to call or to fill out the final form to make a decision, I don't feel like I have near enough or any information to make an informed decision based on special education. I don't know what that looks like, and I understand. First of all, let me back up and say that on Tuesday, I was sitting in your seat, Jay, for Beacon School and having to make the decision of what this looked like for Beacon School. And it was hard, and it was not fun, and so I recognize that there's nothing easy, and there are no right answers that's going to fit everybody's pot. I understand that. So I just want to respect that first. But I do want to ask, how can a parent of a special education student make any decision? Because I don't have any idea. The plan is so vague, I don't know what it's going to look like. So while I originally wanted 100% online for my daughter, I began to think about some of the other children that come to be at my home as a foster grandma. And so it made little sense for me to just choose online, and I was beginning to think about the 2-day-a-week plan. Either way, though, I have no idea what special education will look like, nor how therapies and IEP goals will be even remotely touched if online. And what that, I'd really like to know, the first part of my question is, has there been any, where are we with that? And how does that look? And what are some of those, maybe not detailed specifics, but enough to give me and make an informed decision, because I don't feel like I have enough.
Thank you very much, Margaret. Those are many, many questions we've been tossing back and forth, up and down. And now that the administration has come back, we've started digging deeper into the plan. Special ed is a very big concern for us. We know we can accommodate those students 100% better if they're in the building. Mr. Maskeel, Mrs. Thomas, we're all having conversations of that, and we would definitely hold meetings with those parents. Mr. Maskeel is here tonight to touch base on that topic.
Steal the podium from you. All right, I'll go ahead and do it. So, man, this is a weird situation because I feel like I'm pointed at you guys, but addressing you and the world. So I don't want anyone to think I'm being disrespectful here. We have Mrs. Thomas and I, who functions as the special ed director at the junior high school, and I do a lot of the special ed work at the elementary. We have been talking about our plans and what we're going to do. And things for students on IEPs will be handled as an IEP team decision, including parents, trying to make sure that everything is covered. We have some thoughts and ideas for therapies, whether the students are in the building or if they are at home, because we want to make sure that all of those IEP goals are covered. The reality is I can't give you tons of details, and the reason for that is until we know how many students are in the building versus at home, that may change how we use staffing. So that's our big concern, but it is something that we are focusing on and something that we are going to do everything that we can to make sure that those needs are covered, because we want to protect all of our children.
Still not anything I can make an informed decision on, because I can't tell you that, yes, I want her to be here if I don't know
Sure.
anything about what that might look like. So I'm not sure that there's an answer. And I also feel like I'm damned if I do and damned if I don't when I make a decision. So I'm not sure. I just don't know how those of us who have a special ed student are able to make any decisions until we hear from our team, because I've heard nothing from our team.
Sure, and I think the teachers are at a point where we all are, right? We've had this information from the state came to us late, and so plans got made late, and then those district plans become building plans, become smaller plans, and so we're in that unfortunate effect, I guess, of what's going on. We are looking at, can we make use of Zoom options or teletherapies for therapies? IEP goals, can we look at what can we do on a technology or virtual basis that is targeted not just to the general curriculum, but as well as the specific IEP goals. So we are going to factor those things in. I just can't give you a whole lot of decisions on exactly what that would look like, and I know that's a challenge, and as a parent with kids in the district myself, I share a lot of those concerns, because I feel like we just can't drill all that down until we start to see numbers of who's where, and then we can start building our staff. One thing I will say, I always brag about, especially at the elementary, and not to exclude the junior high or high, but I don't work over at the junior high and high very much. I always say that at the elementary, especially with special education, we've had a different setup. This will be my 7th year in the building. Had a different schedule and a different setup of teachers every single year that I've been here, because our goal is always to be as reflexive as possible to make sure that we are meeting those student needs. So I know that's not a definitive answer, and I wish I could give you more. I truly do. But I think it speaks to the fact that we are always pushing and trying to make sure that we are covering what our students need.
And so the last thing that I guess I'd like to say about that piece is that as I did research for this, a student with a compromised immune system, specifically with Down syndrome, is at a 37% higher mortality rate should they contract coronavirus. When kids who have special needs have been out of school since March, their immune system, even if it wasn't specifically compromised, is now lowered anyway. So any virus, anything, any bellyache, tummy ache virus that comes at them, they're going to get it. They're going to be more susceptible to that. And so now if we look at adding this next, the coronavirus, and thinking about the mortality rate of a young child with special needs coming back to school, and a parent not being able to make a fully informed decision, and I appreciate what Mr. Maskiel said, I'm not sure how any of us in the special ed department makes those decisions when we're given a timeline without information. So I respect that you've given me what you guys can give me. I don't know that that helps me make a decision, but I'd like to know if I made a decision and then the plans were made and they absolutely were not something I felt was right, do I have a time frame to change my mind?
Margaret, we've been working on that, and we have talked about having a 2-week, once you enroll your child and we start school and we've got students in the building, you've got 2 weeks. And if you choose home-based learning and you're like, this isn't working, just call Mr. Maskiel. But we're going to have a 2-week window of opportunity that you can change your mind. When you get to the high school level, it gets a little more difficult because you're working on high school credits for graduation. So we're working on that plan. What students choose for the first 9 weeks, we don't want them floating back and forth between home-based learning and school-based learning. Pick an avenue and go with that avenue for 9 weeks. The first 2 weeks of school, if you change your mind, just call Mr. Maskiel, and we will be holding IEP meetings and 504 meetings. We've got a couple scheduled for next week to start talking to parents. This is fluid, it's got to be flexible, it's a area no one has ever been in. So we are here and we're open to working with you.
Will that be in writing somewhere that I will have 2 weeks to make my decision, to change my mind?
Say that again?
The fact that you just offered 2 weeks to change my mind, will that be in writing somewhere besides the minutes of this meeting?
That should be in the building plans when those come out.
Okay. So the next thing I'd like to say is that in listening to everything, and again, in having my own conversation with Mr. Pepper on Tuesday as a board person, you know, everything points to the safest bet and all of these other nuances and things, PPE and how much PPE and training and all those things, everything points to an online virtual environment, at a minimum for the first 9 weeks, so that all of these kinks and all these unknowns could potentially be ironed out. Because there's so many questions without any answers because no one's ever been here before. So if the safest bet is to be online and have a virtual system with our teachers, I guess I'm not certain why that's not been looked at a little harder without the use of the color system. I understand kids need to be at school. My own daughter's experiencing severe depression and severe social anxiety now that she'd never had before. So I don't doubt in any way or any heartbeat that students need to be in school. I don't, as a social worker, I see all those other things and the other health things and those other things that being in school can help. But there's so many unknowns, and we're putting so much risk on the table and trying to manage so many things, from face masks to PPE to isolation to what to do and how do we do that. If we had that first 9 weeks to be able to say, we're going to create a plan while we're still teaching and educating, maybe we would have a better, more solid plan when we open back up and have students come in. That's just my own personal thought as I think about all these other variables that don't seem to have an answer, and we're rushing and trying to figure out that answer, and then might have to back punt and say, and fix it. Why not try to iron some of those things out before we bring students back to the building? So in the same line, one of those things that really got me to come to this meeting tonight is the policy about pickup for the student who becomes ill. And this is really difficult for me to speak to because I am a social worker and someone who works alongside Children's Services every single day. When Children's Services is called on a family, for whatever that reason might be, the mental health trauma that can occur is significant for whatever that reason might be. It might be a dirty home. It could be abuse. It could be drug abuse. It could be anything. But when we pull in, and I'm the good cop when I go in, it's still significant mental health that's seen on the child's face. When I saw the policy that stated that if a child was not when a family wasn't able to be reached as a last resort, that this district would invoke the sheriff or Children's Services, I stopped breathing for a moment. The number of children in mental health services in this county alone is significant, and the lasting trauma of someone having Children's Services called on them is not something that I would ever take lightly, and I don't quite understand why that would even be put in writing. Why during a time of when this community is already on edge about things, why we would put that kind of a threat there. I can't imagine a young child who was sick, who may have had 100.1 fever. Mom is working in a factory, dad doesn't have any cell minutes, nobody has a car to come and get them, and then suddenly the sheriff is called and they're put in a sheriff car. I can't imagine I have no words for what that might do to that child, and then ultimately that family. Because sometimes there are families that are just living on the edge, and they're living on those edges that just teeters on whether Children's Services should or should not be involved. And something like this could break something open that doesn't need to be broken open. I also don't understand what the point of a phone call to Children's Services would be, because they're not going to come and whisk the child away. There's a process to make that happen with ex parte custody papers and court hearings, and that doesn't just suddenly make a child that's ill in the building get picked up, because we're not allowed to transport them. So I don't understand that language. I understand that there needs to be a solution. I did send an email offering some type of a potential viable solution. We already have Holzer right here in our parking lot. We have the ARC that potentially we could have space there for children who we think may be COVID symptoms, and maybe take them there and then have someone there to help monitor them until parents or family members could arrive. I'm not sure why we couldn't have a school bus or school transportation that could potentially be designated for the use of that and transporting a child home, because sometimes the only way a child gets to school or is able to make it here is because of the bus. We can't possibly think that everyone in this district all have vehicles, all have gas, all have a way to transport, because that's not the reality of where we live. And working out in that every day, I may not work in this county, but I work very close in Vinton County, and I see that every day. So I am here to urge you, please, to rethink that language and rethink a plan for when a family is not able to be reached. I find it's heartfelt sickening to have that in there. And I understand that you have to have something. But using that as the alternative is not fair to families. That's all I have to say.
Thank you, Margaret, very much. For many years, we've had this policy: if you cannot get a hold of parents, and I'm talking 7 o'clock at night, and you're still sitting in the school with 2 children and you cannot locate anyone. There was no ill intention in this clause. We have planned that throughout the day we will have bus drivers available. We also use Athens County Children's Services outreach worker Kent. He's been wonderful about going to homes, helping and assisting families. It's a very friendly relationship. Kent has helped us with many homeless children, getting them to school, taking them home, making sure that they have what they need through the COVID virus. We have planned, if we do come back to school, and Laura and Teresa, our clinic nurse and aide, if they end up with 2 or 3 kids in the clinic and they think they're COVID, they're going to follow the proper procedure, and they are going to contact mom and dad. If we can't get a hold of mom and dad, then we're going to contact every number on the emergency medical form. If we do contact mom and dad and they say, listen, my car's broke down, I can't get there, we will have bus drivers available to transport that child home immediately. We hope to have 2 or 3 bus drivers in the building each day to help and assist with that. So I think that's going to take care of it. Very rarely do we use the sheriff's department, but sometimes when kids do not show up, we know things are shaky at home. If I call, sometimes they say, Lindy, you stay put, we will go. And that's a huge benefit to the district, but there was no ill intention in that clause at all.
So I appreciate that, Lindy, very much, because that makes more sense, having worked with Children's Services for 20 years. Can you reword that policy? Because I feel like there's a different intent given in that words of that policy, because that is not at all what that policy states. And I understand the outreach worker, and I think that's a huge benefit that this district has had for a long time with Mr. Feltz being here. And it should be a friendly relationship with Children's Services, but the way that that policy is directly written absolutely does not in any way capture what you just said.
Lindy, is there a need for that clause? Because I've seen it in other districts. Is there a need for that clause by some policy?
There is. In my 30 years of experience, there's been probably 2 times that we've exhausted ourselves and we cannot find the family. So we are guided to contact Children's Services or the Athens County Sheriff's Department.
Oh, I don't mean like a need within our school. I mean a need in our policy to have that statement.
I think families need to be aware that we've got to be able to contact someone. And that goes not just for COVID, at any time there's an emergency with their child. Many times parents change phone numbers and we're not notified. That gets a little tricky.
Margaret, thank you. Anyone else that would like to make a public statement, please come to the podium. And to make it easy, if everybody that wants to speak, if you would just line up 6 feet apart, that way we could just keep it moving.
Hello, my name's Stephanie Turner. I have a 5th grader, or he'll be going in the 5th grade. So this blended program plan that you guys have, what is your plan for parents that don't have internet access? What is your plan for parents that don't have internet access and do not have a computer their child can use to do online learning?
I will start to answer that, and Mr. Rice is around. We have purchased a Chromebook for every student K-12. We are working on internet access. The library, you can utilize the library. The library has hotspots you can check out. We are working with Ohio Department of Jobs and Family Services. They have funding for hotspots for families. We have wired 5 of our school buses with Wi-Fi that will be parked throughout the community, that you could go to the bus, download the assignments, and take them home. If you need Wi-Fi, I would suggest possibly emailing Mr. Rice, because we are working on that.
Mm-hmm. Well, I live out in the country. I have woods all around. I barely get a cell phone service. And I've attempted to get internet service, and it's either satellite, which is patchy at best, and hideously expensive.
Now, when we talk about home-based learning or the blended learning piece, not everything will be online. So your teachers will design their curriculum and it will go with your child. Where do you live? Tell me that.
I live down on Salem School Lot Road.
Okay, you're way down, Salem
Yeah.
School Lot.
She actually is my direct neighbor. It's back, Doug knows where we live, but I was going to talk to you about that because we have zero options.
Okay,
Yeah.
you're in Columbia Township, and this is one option we have. We've wired 5 buses with Wi-Fi. When Ben Giffen goes home and runs his bus route, he's going to park his bus at the Columbia Township Fire Department.
Okay.
That Wi-Fi's turned on. You guys can pull in. Your kids can download what they need to. They've got Wi-Fi access. You might have to sit there for a few minutes, but it will be available right there to your children.
Okay.
Then if we can find a hotspot that truly works at your house, it's a huge problem.
Yeah.
But we will try to figure something out. But you will have a bus at Columbia Township that you can connect to the Wi-Fi.
Okay, good. Oh golly, so there's not going to be this like Zoom videos that the child is going to have to be required to attend?
Zoom in at 9 a.m. and don't be late. No, we are working on that, and we've had several meetings with our teaching staff, curriculum director. What does that look like, the blended learning piece? we are still working on that, but we're looking at pre-recorded lessons, and that they will be uploaded online, and then you can download and watch them at any time. The teachers are still working on that. It's all new to them, too. One request through all the meetings we had this week is our teachers need time to redesign the delivery of the coursework.
Yeah.
So one thing we're looking at the beginning of the calendar is bringing in the teaching staff, let them create their lessons and get a good handle on it. So we're looking at possibly starting students August 30th, which would give our teachers 10 days to team teach together, learn from each other, master Zoom, master Google Classroom, and prepare for that learning piece of remote learning.
Okay. One other thing, with the blended program that you guys are thinking about doing, that basically means that a parent has to stay home. So we're, my husband can't find a job because he's home with the child. Unfortunately, we only have one child. I don't have an older sibling that can watch him, and he's too young to be home alone. So don't you all think that this is going to have a huge economic effect on the community as a whole? Not just this year, I'm talking about 10 years from now. I personally feel that school should be 5 days a week. We take risks every single day. Every time we get in our car, we're taking a risk. Every time we swim, we're taking a risk. And understandably, yes, COVID is scary. Yes, people are dying from it. But people are dying from car crashes, too, and drowning in a pool. So we can't live in fear.
I understand, and I mean, since March 7th, I've played with COVID and possibilities and different schedules, and how do I keep my staff working, and how do I take care of the kids, and what is truly best for the kids. Lots of questions. I understand where you're coming from. The board can chime in or talk. I mean, it's many considerations we have to think about.
Yeah, my son, he's the only child. The only actual children interaction that he gets is at school. Yeah, there's a few kids in the neighborhood that he plays with, but the group children interaction is, and honestly, I'll fully admit, my son is socially inept. He has a hard time interacting with other children. And with, the therapist's help here at school, Megan Dean, and counseling, he is slowly getting better. But I feel like him being gone at home since March, it has benefited him because he doesn't have that social anxiety anymore. But in essence, it's just, I'm just worried about the long-term effects. I truly am. For not just my child, every child, and the economy. Because most families aren't one-income families.
I just want to let you know, I think everybody on the board knows what you're talking about. I mean, me specifically, regardless if we do a 2-3 option, full online, whatever you want to, if my kids are home, both my wife and I have to report to work.
Yeah.
We're going to incur loss to our way of life, however you want to put it. So you are not alone with knowing or feeling the economic impact of whatever decision happens.
Yeah.
And so
Okay.
in the 932 emails in the past 2 weeks, a lot of that was addressed as well. So
Okay.
it's not falling on deaf ears.
Okay, good. Thank you.
I think too, it's for me, and that's why I'm pro going back. school has changed so much over the years, and we're basically a social agency as far as kids' nutrition,
Yeah.
physical, mental health, socialization. We like to say, well, you always have sports. Would you realize with sports, not just the kids that participate, but that's a social function for a lot of our kids. That's the only place they get to go, be with their friends, and not have someone telling them to be quiet or sit down or whatever.
Yeah.
So the five of us, we've been living this since it started. There's no easy answer. We're not going to please everybody. Half the people want to stay home, half the people want to come to school.
Well, I'm glad
But I
you
can
have a-
assure you there's been enough discussions and enough phone calls
Yeah.
between the board, the health department, emails, you name it.
Okay. I'm glad you guys have that Chromebook option.
Well, the kids will be first. I can assure you that.
Okay, thank you.
Thank you.
Bear with me because I have a bunch of notes.
Okay,
First,
wait, let's make sure we announce our names for Josh,
Oh.
so he knows who's talking first.
sorry, Nancy Witten. I am the non-certified union president here at Alexander. And the first thing I want to say is, first, thank you, because I know in spending all this time with Lindy, it's been hard. And we spent a lot of time ironing things out, hashing things out, and I want to make sure people out there understand in all my heart, Lindy has your kids first. She's got your kids' backs. And never have I seen a community so divided as what's happening here. Like you said, they're polar opposites. And I have a tremendous respect for this virus. I have 5 people in the healthcare system, a daughter who's on the COVID floor. So don't get me wrong, I know how serious this virus is, and I know it's scary. I'm known as the mask Nazi around here, because I was on top of people about masks. We can't iron out every detail. We can do our best, and we are trying every case scenario. Both unions have been represented here. Both unions are pouring into this. Both unions are getting a say. I've had multiple emails out to all our people. What are your concerns? Tell me. Let me know. Let us bring this up. It hasn't been easy, but we're brainstorming a lot. And with that in mind, this 2 days on for two amount of kids and 2 days on for the other amount of kids, the good thing about that is, as a parent, you have that choice. You have the choice to allow your child to stay home completely. That is an option you have. Or you have an option if you need your kids to be back at school a couple days a week and you want to get them back into school and it's a safe environment, and we are, believe me, cleaning has been #1 priority with this. It's scary, but we're going to get it clean, and we've have multiple spray bottles around with this really strong stuff. We switched to orange today. We don't know when it's going to happen when the OU student comes back. It's scary. I think there's some options there we could look at. I think it'll be different. It's going to be very different. No matter what we decide to do as a community or as what this board decides is going to be different, whether it's home, whether it's here, whether it's not. But there's a few things. I think kids do need to be back. I don't think 5 days is a good idea, because it is about our kids mostly, but we have to protect our staff, because if our staff goes down, your kids stay home. So when you put 25 kids in a classroom for that amount of time, 40 kids on a bus, for some of them an hour, it's going to be a different picture. So I would really strongly disagree with the 5 days a week. And it's not that I'm trying to diminish your concerns. I don't do that. I'm not trying to diminish what your thoughts are and what your concerns are. None of us have that right. We all have different things going on in our lives. Elderly, we're taking care of, kids with issues. That's not what this is about. This is about trying to come up with the best case scenario for all. We're going to need to iron out kinks all through this, and it's going to be. We're going to be constantly talking to each other. The only few suggestions that I would ask that you consider is that since we are very concerned, obviously, about the OU students coming back, we have some that may be back this fall. Maybe want to consider not letting them come back here at all until after we've gone through this first 9 weeks, because we don't know who those OU students are interacting with. We may think they're social distancing, we might not know who their roommates are social distancing with or with not. Just a thought, just a suggestion. The other thing I would like to see happen, because our clinic staff will be the staff who's most at risk here, that's a reality. I would like to see them be provided with that N95 and those gowns. I think we need to keep them extremely protected, because they are going to be the ones who are really at the greatest risk at this point. And then comes your paras and bus drivers who are on the buses with the kids for an hour or whatever, but we're working that out. I sent out emails to my paras. I sent out emails to all our non-certs. I only got one reply back regarding concern. So that I can then assume, maybe I shouldn't, that we're going to be okay. We're on board. It'll be scary, it'll be concerning, but I think if you look at your best case scenario, if we can cut that amount of kids on the bus, if we can be careful with the kids that we put in here, and don't get me wrong, this virus concerns me. It's a huge concern. I'm worried just like you are. But if I look at the big picture and step out of my box, out of my immediate about me, and look at the rest, the kids do need, a lot of kids are saying, I want to get back. And it'll be different, and it might be hard, but I also think they maybe rather be here, even seeing their friends or seeing a teacher, than be at home all that time. Just my thoughts. I do appreciate how much you all have kept us in the loop as far as staff and stuff. It's been wonderful, and I know we have a long way to go, and we'll still be working it out. But that would be my request, is don't go 5 days, and maybe give them the chance to start.
Good evening. My name's Bruce Voss, and I have 2 children that are in high school next year. We've been out of town, so I apologize ahead of time if I'm asking questions that may have already been addressed. In general, I have kids that are on both sides of the polar opposite of what they would like to see happen next year, but for me as a parent, I have 2 questions that seem to override their personal choices in some way. And that is, if we send our kids to school and we're trusting that we're going to follow the rules that have been laid out, such as wearing masks, social distancing, but you know, and I know, that there will be kids who will not want to do that, or refuse to do that, or decide to make a joke out of it, or whatever, and potentially putting the rest of the students at risk as well in their classroom and their teachers. What is the real way this is probably going to be dealt with if that happens in a classroom? That's my first question.
Thanks, Bruce. I can tell you just from myself and talking with various other board members, I think I can safely say that it's our opinion. So I guess I should better speak for myself though, but the child is going home. We have all spoke about mandating masks, at least 3 through 12, based on the governor's recommendation. Unless you have a valid medical waiver, you're required to wear the mask. That's something that we'll address here and vote on later. Okay. But to make this work, wearing a mask is critical. And if you do not have a valid waiver, medical waiver, you go home. You're remote. I guess I shouldn't speak for the others, but we have had that discussion, and that's my opinion. I'll let the others chime in.
I don't mind. I know I was at a meeting yesterday with the administrators where both of them said if the student refuses to wear a mask, they'll be sent home. And that was, I don't think there was much conversation about it. It was simply stated.
That's been my understanding all along. I mean, it's not debatable. If you can't follow the rules, you can't put others in danger, and then you go home. I mean, it's not going to be anything other than just go online. No choice.
Okay, thank you. And then follow-up question. It's my understanding, indirectly understand that the classrooms will be divided so that some kids come one day and some kids come the next day, so that there's not, the whole class is not all there all at one time, reducing the number of students in the building on any given day. How is that going to be determined as far as which kids come on day one and which kids come on day two, and will they be equal amounts of kids on each of those 2 days?
Thank you, Bruce. Those are many questions that we have worked through. What we're looking at, we listen to the teachers and we listen to the parents, and the teachers want to keep that Alexander kids and the parents want to keep the Alexander teachers, and how do we do that effectively? The teachers also requested to have Wednesday off as their remote learning and teaching day. So we will have 2 groups of students that come to the building. One group will come Monday, Tuesday, and be with their teachers, and then they will remote learn Wednesday, Thursday, Friday. The second group will come in Thursday, Friday, and be with their teachers and learning on campus, and anything they need to work on Monday, Tuesday, Wednesday will go home on Friday. How are those groups determined? Once you enroll your child into final forms, they upload into the system. We know which students are staying home for home-based learning, and then we'll know who all's coming to the building. Then those will be exploded into the EMIS system. And then we can group kids by households. So if you have 3 kids in the household and they have different last names, when we group the kids into 2 cohorts, the children in the same household will go the same day. Now, if there's a glitch and you get a notice your kids are going different days, just call us and we will fix it. But they will be divided into 2 equal cohort groups. We are looking to keep all class sizes less than 15. Brian McCollum measured the rooms, and we've ordered stickers that say maximum occupancy. Every room will be labeled with a sticker of how many people can be in that room at any given time. We have also, I'm trying to run my head through all this. We also have purchased red dots, and they're like 4-inch red dots, and the janitors or the teaching staff can put them on the floor, and every kid will have a red dot. They know where their desk is, they know where their personal space is, and they'll stay within that. We're looking at lunches, that we will have smaller groups coming to lunch. We will social distance. We've also talked about purchasing 12 nice picnic tables to put outside. So if students want to eat outside and have that fresh air, they will have that capability. That's why it was so important to get the administration back in, so we can work on a lot of those little details.
So the plan is to have hot lunch still and to have them in this room?
Yes, I've talked to the Athens County Health Department, Jack, and he said if we can social distance and not have a huge amount of people in the cafeteria like we used to, he is okay with that. We are looking, we haven't decided yet, but like breakfast may be served in the classrooms, and we would take the breakfast to the classroom before the teachers get here, so everything's in there. We're working on that. We're also waiting to see what the state does with free and reduced or free lunches for everyone. They are considering offering that again through the school year as they did for the summer.
And is there a plan in between each group of kids that comes through the cafeteria to wipe down the whole room prior to the next group coming in?
Absolutely. We have 2 janitorial staff all day long, but we're adding an additional 2 to 3 people in the building. So when one small group comes in, once they leave, everything's cleaned, wiped down, sanitized.
Okay.
And then the next group will come in.
All right, those are my questions. Thank you so much.
Thank you, Bruce.
Yes, I'm Ben Giffen. I'm actually coming here in 2 different areas. I'm actually an employee here at the school. I drive bus, and I work in the kitchen and help with the janitor staff. And I've been here ever since right after spring break. We came back helping, and then through the summer prepping meals and delivering them. And I've seen a lot of the work that Dan Phillips and Brian have put into this and the efforts that are going on. And we know, as far as the drivers and custodians and the cooks that coming back, there is going to be a lot more work involved. And like Nancy was saying, as far as she didn't think we didn't have as many concerns. We understand that there's going to be a lot more effort going into this, and I think for the most part, we're willing and we're okay with that. I mean, we understand this is going to be a lot different than normal. And speaking as a parent, I have a young child that goes here. I want him to come to school. You know, I don't fear for that. I am okay with that. And, you know, hopefully it stays like this, where at least we get the 2-day-a-week thing to where he can come, because I think that is good. And I just wanted to come and make that statement. I know that things will be different and there's a lot more involved this coming year, and, you know, we're willing to do that work. And, you know, to make it to where my kid can come back to school is my goal, and I hope we get there. Thank you.
Thank you.
Hello, I'm Ryan Hoover. I'm the father of 2 children in the district, a rising 6th grader and a rising 10th grader, both with special needs. I'd like to thank, I believe your name was Megan? Margaret. I'm sorry about that. You've already taken several of the questions that I was going to ask, so I appreciate that. First, I'll actually echo your concerns from the end of that statement, and I realize that, you know, how things are written, especially with everything changing, sometimes we can say things without completely realizing how it would be taken, but I'll echo it just from my daughter's standpoint, who, when we were going through the documentation today, she is an adopted daughter. She's been with us for 5 years, and she's now 17 years old. She was with foster care on and off for 6 to 8 years. And it took me a good 20 minutes to calm her down after she read that statement at the end, just from her freaking out about, oh, she doesn't want to be taken. And I realized that you would do everything in your power to make sure that that didn't happen. But that is the reaction that you will see from somebody that has been in that situation, just to make sure that you see it from a child's perspective. Thank you for addressing the election of the options for the parents, the 2 weeks. Is there, and I realize that, you know, you would probably be able to work with a parent as much as possible, you know, as things change, situations change, jobs get lost, jobs get hired back on. But for right now, you're saying if at all possible, we'd make our election within the first couple weeks, you'll work with us. After that, it might be a little bit more problematic, but again, if we come to you and say something, you're going to endeavor to work with us the best, as best as possible.
Good to see you, Mr. Hoover, and I miss Emma. I miss that smiling face. She's a great girl. Yes, I think that's what we have to understand. It's flexible and it's fluid.
Okay.
And Aaron Thomas is right there to help you. Jobs change, you're right, babysitters change. And I've had several parents contact me, say, hey, if I get on Thursday and Friday and that doesn't work for childcare, what do I do? I said, just give us a call. We'll figure something out.
Okay.
So, and you're right, jobs change, child's needs change, and that's where we sit down and have a personal conversation.
Okay. So with the options this year, is there going to be options where we can do meetings and any instruction, whether that be via IEP or just regular instruction? Is that going to be, is there possibilities for video conferencing this year?
Possible for what?
For any kind of meetings for IEPs or just regular and or specialized IEP instruction? Is there anything that has been being done via video conferencing?
Yes, we're going to try to run school as normal as possible. So we will still have our IEP meetings. We will still have them in person if that's what the parent chooses. Some parents would rather Zoom, so we will make that accommodation. Once we know where we're starting, A, B, C, or D, on bringing students into the building, then we can start breaking it down even more. Special ed department, that's a huge, overwhelming piece, and we're looking at that very closely.
Okay.
I don't mean to cut you off real quick.
Yep.
I just want to, that directly conflicts with what our plan says. It says that our IEP meetings, ETRs, will continue to be held using conference call technology. All mandatory meetings such as IEP and ETR will continue to be held using conference call technologies. So so either we have to amend that, or that's incorrect. Our IEP's meetings will be held using conference calls or Skype technology. Sorry to interrupt.
Mr. Maskiel?
Yes, I've stolen the remote mic so that I don't have to cut everybody off. So I think we're kind of somewhere in between. I think the idea is as much as possible to be able to make use of the conference call system and Zoom technologies or video teleconferencing for the safety. But we do know there are families that may not have access, as we've heard earlier tonight. There are families with internet connectivity issues, potentially even phone issues. So we can make arrangements for the handful of times that video or telephone conferencing will not work. I think one concern that I want to mention is there was a big concern last year with our special education population that felt virtual learning would have been great for them. And I think there's a kind of an elephant in the room of why are we saying we could do it this year and we said we couldn't do it last year. And the reason is because we didn't have time to pull together those one-on-one devices, the hotspots, all of the abilities that allow us to do virtual education across the board. So special education law says if we are doing it for one student, we need to provide that for all students. And last year, we simply were not able to provide it. But we've spent a lot of months since March figuring out how can we do that, because our goal was always as much direct service as possible.
Thank you. Changing gears a little bit, in terms of case management for students that have either become symptomatic at school or symptomatic at home, is the school doing any follow-up, or is it basically just on the parents, in their honor system of, hey, on such and such day they had this, and whether it's either 7 days from the start or I think it was 72 hours after they're free of symptoms, they're able to return. Is the school doing anything with that case management, or is it basically on the parents and the health community at large to do to follow up with that?
If I understand you correctly, are we following the health protocols? Are we enforcing that, or are we enforcing that, or are parents enforcing that?
Essentially, like, is the school doing something where we have to report in, to a nurse or something like that at the school in order to return?
You're talking about the wellness check before this child gets to school.
Yeah.
Temperature check, are they coughing, do they have a runny nose, those checks. Our plan is this: And once again, we're always fluid. We had this conversation today also, again. If we run on Plan C and your children are getting picked up at your house, there will be an aide on that bus. When Emma gets on the bus, or when she gets to the door, Nancy's going to walk off the bus, take Emma's temperature, do her wellness check, and she can get on the bus. So we as a district, if we're running on Plan C, we will cover that. Now, if we ever get to Plan A, that would fall into the parents' hands. The parents need to make sure their children are well, no fever, no Tylenol, and ready to go to school.
Thank you. Along those lines, is there any kind of modification to the absentee policy or documentation that needs to be provided from us?
Absenteeism, that's a big question. We've had many conversations with the juvenile judge and the county prosecuting attorneys and children's services and truant officers. We have to look at absenteeism a little differently this year because of COVID. If a child contracts COVID, we know they're out 14 days. We don't need to press charges. Just send us the doctor's note. We know absenteeism rates will probably go up this year. So we're going to work through that, but there is leniency for that.
As of right now, the current start dates are the current start dates for the school. That's not being considered for any changes?
We had it as the 24th, but through meetings with the teaching staff, they really feel we need another week to prepare. So we would like to start students August 30th.
And I apologize if this has been online, but I hadn't seen it yet. When do we have to have the final selection for what our student is doing in by?
Say that again, sorry.
I apologize if this information was already presented online, but when do we have to have our final selection as parents for whether we are keeping them at home or sending them to school in by?
We will have final forms. We've got it programmed. We've got it up and running. You should receive your email to go in and start enrolling your child. Those emails should go out at the end of this week and definitely next week. We haven't really put a time limit on when you have to choose, but as people are choosing, that gives us the ability to start placing children in classrooms, balancing out cohort red and cohort black. But if you choose option 1 and by August 24th you've changed your mind, it's okay. Just give us a call.
Okay.
Everyone's going back and forth constantly. I've had people complete surveys and they call me the next day and they said, Lindy, I think I changed my mind. I said, it's okay. Everybody's mind is changing every day based on the information that is given.
I apologize, I just had one more question pop in. So I think I read, at least briefly, that the school has at least a selection of masks and some sanitization. Is that going to be available for the school if, for people that either can't provide them or for, knowing my daughter, either A, forgot it, lost it, whatever happened?
We've talked about those situations too. Yes, we have, Brian feels we have enough PPE for the first 9 weeks. We have a lot of PPE ordered. We have donations coming in from HAPCAP, Athens County Health Department, OESCA. So we're trying to stay on top of that. We understand kids might forget their mask. We will have disposable masks to offer them. We understand some chew on them, and by third period, they do need a new one. So if a child forgets their mask, we will assist them in that. And we should have plenty of PPE.
All right. Last question, then I have 2 statements. Are they going to have to wear the mask 100% of the time, meaning is there going to be any chance for breaks where they can either go someplace where they can be further apart, where they could breathe without the mask on? Is that going to be available during the school day?
Mr. Maskiel.
Get ready to feel. So we may have, depending on age, some variability. Obviously, kids will be able to take them off during lunch. Our goal really is for third and above, starting day one, those students will wear their masks the entire day except when they are largely eating and drinking. Our younger students, we know that there is a learning curve there, and we know that that would be a lot to ask a 4-year-old to come in and wear that mask, starting for 7 hours a day. So we have said in our plan, if it is adopted, that we would have all students wearing masks on the bus, in the hallways, those common spaces. Preschool through 2nd grade would have them the ability to take them off in the classroom, but with the idea that we are continually adding time so that they are wearing them for a full day. We mentioned the ability to have an opt-out if there is a documented medical concern. The other thing, and this could be a time for some potential midday breaks, would be special education concerns. We do know that there are students with sensory issues that the wearing of a mask could in itself be a barrier to their education. And so in those decisions, again, we'll have IEP teams making informed IEP decisions, making sure that we are balancing all of those needs.
Thank you, Mr. Riscale. Thank you for answering all my questions. I know that, I mean, you guys are basically between a rock and a hard place on this. It's a very difficult time, and reiterating your thing, you're not going to be able to please everybody. And I think we all understand that, even if we get angry and frustrated. So we do appreciate that you are trying your best. Just know that we have a lot of concern and we have a lot of questions, and we know that everything's changing on the fly. 2 things I will say, one from my wife, because she heard it on and on, is that several people have talked about the OU students returning to campus. She wanted me to say that the vast majority of students aren't in the residence halls. 12,000 of them live off campus. Now, while some of them probably aren't there, there's quite a few that are living there right now. So anybody that's looking for the OU students to be back, a lot of them didn't leave, so they're here right now. Just so everybody knows. Last thing is I heard people talking about internet access, and I know that for some people that is a struggle. From living on OU's campus briefly, they do have a free internet for the public, where if you are pretty much anywhere on that campus, that you can have access to that. You just go to their website, search up OU internet, and pretty much anywhere on their campus you can have access to that internet for a set amount of time for anybody that might need it. Thank you.
I'd like to point out that on page 4, daily staff and student screening, it mentions students are self-screening. It doesn't mention the bus ride and staff screening students. It's confusing, and it needs to be edited.
Hi, Carla Pratt-Harrington, one of the co-presidents for our Alexander Local Education Association, the Teachers Union. I'm also a proud parent of some graduates, a community member, upcoming grandchildren. I have a lot of investment in this place, and I want to say thank you for listening. This is a long time to do this. And thank you for all coming and supporting our school and letting us know how important it is. I debated on whether or not to come up because this feels like internal stuff, but I would be remiss if the public didn't know that we did survey teachers a couple weeks ago, and it's clear that there are some concerns about coming back, and that's personal, and that's fine. My concern is really practical. We have a number of teachers with compromised immune issues or things that make it really not possible, and their doctors have talked to them, and some of them are deciding to not be here until this clears up. it's sad because there are people and we wish them the best and we certainly don't want to put them in harm's way. But it puts us as a school in a really awkward situation in that we really, I think, as much as I hate to speak for all teachers, I would pretty much bet we all want to be here with kids. The question is whether or not it's safe enough, right? And I just think trying to fill all the teachers' slots, and we're talking, when we did the survey, 23, I believe, % said they would consider taking a leave of absence. That's a large number. I don't imagine all of them will do that at all, but even if a fourth of those would do it, I think it really puts us in a situation where it's questionable whether or not we could really follow through with finding people that could adequately fit into those slots. I will also say that the administration and Lindy has really worked hard trying to figure this out. I keep waiting to come to a meeting and they're all standing on their head trying to look at it a different way. I mean, they just have really, really worked extraordinary hours trying to figure this out. And it still concerns me. I still am worried that day one comes and we won't have enough teachers to do what we say we can do. And I think that that's a really important piece to look at. Regardless of what we decide, can we do what we say we're going to do? And it's not, again, it's not the teacher's fault. If you have diabetes, you shouldn't be here. If you, and that's between them and their doctors. But I really have a concern that we get to a place and have to scramble and change our mind, and that concerns me. Thank you for listening. You guys are amazing.
Hi, everybody. Chris Reitzel. Lindy, can you provide more detailed information about option 2, what that really is going to look like for families who choose that?
Home-based learning. What I can tell you is students who are on home-based learning will work with an Alexander teacher, and the principals can chime in because they've been working on this. Students on home-based learning will receive materials, textbook, Chromebook, tablets to access online programs available through Alexander School District. Project-based learning, paper pencil, Edison Learning, Google Classroom, Accelerated Reader, and other online programs will be utilized, but it will be the teachers that create the lessons that go with the standards for those content areas.
So, I guess in my mind, when I'm thinking about this, first of all, I'll say this. I am so grateful, unbelievably grateful, that we have the option now of having home-based learning with an Alexander teacher. I mean, I can't even begin to say how much gratitude I have to the teachers that Maggie has had this time. I mean, she is, very much who she is because of the influence of the staff and her principals, who everybody at this school district that we have ever worked with has accommodated every need that we have ever had. I mean, there is no end to the gratitude I have. And so I have this huge, immense confidence in the staff here. So I guess when I think about this home-based learning, I'm trying to reconcile in my mind how are teachers going to do this, and what will this look like for Maggie, for example, if we choose this? If she was here at school, she would have multiple teachers. So does this mean she would have one teacher who will coordinate all of this? Will she have the option to, she talked with you the other day about taking French class. Will it be the same as if these children are here in school part of the day? Or how will it differ?
Mr. Raines, Mr. Ford, you can chime in. We are working on that plan now. We are looking at if she's going to have French, she'll have it with Mrs. Stamper. And Mrs. Stamper will design that home-based schooling. Now, it may be pre-recorded lessons with Mrs. Stamper. It may be written assignments that she gives. It might be a project-based assignment. But if she signs up for French, it would be with Mrs. Stamper. And Mrs. Stamper designs the home-based curriculum. Correct me if I'm wrong, but it is a work in progress, Krista.
Yeah, no, I understand.
I think that's the anxiety of the teachers. You know, the curriculum is there, the caseload of students is there, the delivery model has changed. So that's what we will work on next week through August 31st. But the administration is putting that together, and then the teachers are going to start designing that curriculum.
So then, for example, her math teacher would be the same math teacher that she would have had if she was here. Same for, okay, all right.
Correct.
That's immensely helpful. So then, do you expect option 2, and I apologize if I've just not understood this from what is available, but will option 2 then be available to students? Do you expect that to be available to students all year long?
Yes, I do.
Okay.
I do.
So then, am I understanding correctly that every 9 weeks, a student might have the opportunity to transition from home-based learning back into the district? Or will that be difficult due to the planning the school district already has in place?
Mr. Raines, I'll lean on you a little bit with this, or Mr. Ford. I know, now your daughter's in 8th grade, so I think it could be fluid where the first 9 weeks she might be home and your confidence is built up and you're ready to send her to school 2 days a week, second 9 weeks. Mr. Ford?
Yeah, I think that the premise behind option C, and we talked about this yesterday, is that what we're going to ask kids to do when they're in a building 2 days a week, 60% of their learning is still going to be remote. And so we're looking at this from an instructional design perspective and saying that even the kids that are here, I don't know if you're familiar with the term flipped classroom, but something with that design in mind, that those resources will be available to those kids, then it would be the same material. That starts to change if we would go back to 5 days a week. I don't know how we continue to do that with the time the teachers have got to plan and be able to administer that. Mr. Regan had talked about a curator model, and I like that term, that idea that might change to there's a specific designated person here in school that gathers up that information for the week and sends it to you.
Thank you. Okay.
Brian, could you explain the term flipped classroom? I've not heard that before.
So the idea behind the flipped classroom, I'm not an expert on this, but I've been talking with some of our staff that are working on that, is that instructional material would be provided to them ahead of time, whether that be short pre-recorded video segments, whether that be, it could be screen captures from whiteboards, material like that. And so the material and the assessment is available to students ahead of time when they come into the classroom with that in front of them, and then we try to address gaps in their learning or their understanding of that material. If you're familiar, a similar model would be Lon Kappa, if anybody's had Mr. Hendershaw's physics classes, where the students have to work ahead of time and then they walk in with, here's what I don't understand, let's address those problems.
Thank you.
Does that answer your question?
It does. Thank you, Brian.
Mr. Ford, I was just going to elaborate a little bit more on that idea of what a flipped classroom for any parent out there that's trying to figure out what that is. If you think about a traditional classroom setting, you get taught or lectured or told what to do in a classroom, and you get sent home to figure out if you can do it or not. Homework. A flipped classroom, hence being flipped, you get that lecture or instruction at home, and then you do the implementation or the actual seeing if you can carry out those said procedures in the classroom with the teachers. So that's the idea of why it's called flipped. It gives it not, whatever you want to say, the traditional model of I'm going to show you how to do it, and then let you go and see if you can do it. And says, instead, while you're trying to do that process, the teacher is there with them.
That brings me a little bit to one of my other questions. How is the district planning to prepare students and families for either option that they choose, for what the environment will be like here in school and at home, and for those families that choose option 2, how will they prepare for that? And in addition, wearing masks all the time is new to all of us, and I have not seen a situation yet where somebody has not had to go, I need a breath. And, I imagine this will be very obviously challenging and possibly scary for many of our students, especially younger students. So what thought is being given to that, how to emotionally, psychologically prepare kids for that when they start school?
Krista, we understand it's a whole changing point in everyone's life. Social distancing, staying within your groups, wearing a mask whenever you go out, not forgetting it in the car when you walk into Walmart and have to turn around and go back. But we understand that's really, really tough. I can tell you the administration's working on that. That's why we stated, K2, we will work with students to wear masks. We highly encourage students to wear masks, but we don't want kids crying over it either. 3 through 12, we know they need a break. There may be a time where Miss Guffey walks in a room and a little boy's, he's sweating and he's hot. Take a break. Go to the back corner, wipe off your face, breathe, take the mask down for a few minutes, and then come back. So we understand that's a work in progress. The building leadership teams are working on that. It's a change, but I've been out and about taking care of my mother, and I've seen little kids in restaurants, and they've got their masks on, and that makes me feel good, that parents are practicing with their children now.
Yeah, and I guess I'm just, I know there's so many decisions to be made, and we're getting to that point where we're running out of time for that, but I guess I'm hoping there will be information available on the website or sent out to parents to help them. And I know most families probably are already preparing, independently for this and helping their kids, start to think about these adjustments. But I do hope there might be resources made available on the website for families, if all possible, to help, to suggest how this might look to kids when they get here, and recommendations for how families might prepare. So.
Mrs. Guffey?
I want you to be aware that the administrators have met and have continued to meet, and we had already come up with several things to address exactly what you're talking about. Because, for example, at the elementary school, our students haven't had a one-to-one device. So to even turn it on, they don't know. So we've discussed different ways of, getting devices to them. We know not only training the young students how to do it, but also parents on how to access it. It's a huge learning curve, and we're going to go slow to go fast. So we already said the very beginning of school, whether we are remote or blended, doesn't matter, our whole teaching the students and teaching parents how to access these things. What that would look like at the elementary versus the junior high and high may look different, but we've already, even through the technology department, have discussed coming up with actual how to do it forms and videos to put on our website, as well as possibly having some meeting space time where we could bring in parents to the building with social distancing and walking them through it or walking them through it with their student. But we also know that we have kids that don't have access, or parents don't have access to coming to this building. So we also have other staff that have been, have offered and willing. We've talked about our partnership with Children's Services and Hopewell. They are all offered and are willing to go to those houses and take items and teach parents how to do these things and or students. So we were on it. We do not have that complete yet, but as soon as we have kind of the direction we're going and the platform we are going and know what people are wanting, that's our next step.
I think that's an A+ answer. Thank you
Okay.
so much,
Good,
Melissa.
that makes me feel better.
Thank you. So I promise I'm almost done. So does the school district, do you have any idea what number of students might, or families might be thinking of option 2? I know the survey's not gone out, obviously. And possibly what number of students might really be helpful to the school district if they selected option 2 in terms of making the situation at the school more safer for teachers and possibly easier to implement?
You mean based off of a survey before we went red? Or do you mean based off of emails?
Any information?
I can tell you based on the conversations I have walking down the street or emails or it seems about 50-50.
Okay.
It seems straight down the line 50-50 of purely online versus some type of face-to-face. And that face-to-face then starts getting broken up into 2 days, 4 days, 5 days.
Mhm.
So that's just my personal view. But
Mine, Krista, and I didn't recognize you the other night because I had to ask Jay who you was. She graduated with my son, but that's been a long time ago and I forget.
Yes.
My experience has been running about 70-30 to get kids back in school. Now, it varies from the days and things like that, and it's been a lot of two-person working families that it's really going to create chaos any way we do it, but they would like their kids back. So, and that's probably 18 or 20 people. So, I mean, it's not a large segment, but it's basically, that's why they contacted me.
Okay, yeah, thank you. One of the things that I think has, obviously led to anxiety and so many questions is the scarcity of information, which I understand to a large extent. But at this point, listening to this meeting tonight, so many concerns have been addressed. And I'm wondering, I'm guessing there probably is nobody that has any time at this point, but some of these answers that are being provided, if there was a frequently asked question, site on the website, so as the district works through these, perhaps those plans could continue to be posted and also people could ask questions there.
That's what we were thinking after this meeting, and we know what direction we are going to go, that would be the next step. I've saved every email, and as the administration builds the building plans and comes up with the schedules, there will be a team working on frequently asked questions, and we will build that for staff on the T drive, and then we will build it for parents on the website. But
Great.
there was so much to plan to get to this point that the next thing would be the frequently asked questions.
Yeah. I mean, it seems like we've moved forward quite a bit just since the last meeting, obviously. So two things. So the list of symptoms that we will be concerned that students may be exhibiting and should not come to school. And I think this has been asked different ways. How Maggie has allergies galore. She has every COVID symptom, since October of last year, August of last year, that you can, they just go on and on. And so in good conscience, I would not want to send her necessarily to school and scare teachers and students and have her bombard the clinic, which I'm so worried about Teresa and Laura. What do we do about that?
I don't mean to, I just got to keep getting blown up by people online. Mark, do you know if the mic being used in the back is actually hooked into online? Because I'm getting comments that they cannot hear it. All right, thank you.
I'll take a stab at it, even though I'm just giving you my personal opinion, but the Plan C gives you as the parent the choice. You're on the front lines with your child. If there are symptoms there, if it concerns you, you have the option to do remote. Like other parents, if their children, if they're fine with their children going to school, they have a choice to send their child to school. So the first line of defense is you. If you're telling our clinic staff that she has been dealing with allergies, that's information that I'm sure they will gladly accept, but they're still going to have to go through the protocols. And I'm speaking probably out of turn, and Laura, if you want to jump in, but.
You're correct.
Okay.
I can't diagnose, so I can't determine whether that is an allergy symptom or if that is.
Teresa, I'm sorry, can you use a mic? You can borrow mine if you want.
Or I can, here.
I'm no good at it, so there you go.
I cannot diagnose, so therefore I cannot determine if that is an allergy that's causing the headache and the runny nose, or if it is actually a COVID symptom. Therein lies the problem with the guidelines that we are being handed down, because we see probably 40 students a day with the majority of the COVID symptoms. That's where we're going to have some issues.
I don't mean, do you mind if I follow up? So is our protocol then, if you see any of those symptoms, you have to err on the side of...
That is the CDC and, all the recommendations from Ohio Department of Health, CDC, that if somebody is exhibiting signs of COVID, which would be any one of those symptoms, we have to send them home.
Teresa, this is Josh. You just mentioned that you see 40 students. How many of those 40 are kids that would display symptoms that would register on the list?
So we actually see on a non-COVID year, we see 75 plus students a day. And that can be ranging from daily medicines, diabetics, that, well checks, let's say. But out of that group of 75 plus, we see close to, or if not more than 40 a day that come in with a headache, a sore throat, they've thrown up, I don't feel good, symptoms
40 students a day.
on average, yes.
Let's let that sink in for a moment. Do you have any way to house 40 students who are checked out or who are marking the list of COVID? Do you have any way to house and monitor 40 students while you're waiting for folks to show up?
To socially distance them, if all 40 are there at once, I don't believe so at this point.
And if you take that 40, if we bring in half the students, that number should drop. But we've had discussions again that we would have a well clinic, a COVID clinic. We will have 3, I think, Laura or Teresa, quarantine rooms. And then we will try to get the students out of the building as quickly as possible by mom and dad picking them up or arranging transportation. And then we may have to use the gymnasium or the library if we have more than 5 or 10. We would have to look at using an empty space.
I just want to make sure not to jump in if you were trying to, Josh, I'm sorry. But if I understand you correctly, you don't have the ability to separate somebody from a well clinic and a COVID clinic. If you have a runny nose, you're a COVID clinic.
Can you repeat that again?
You don't have the ability to diagnose a common cold runny nose, allergy runny nose, itchy throat, loss of taste, as a wellness clinic. It goes COVID, go home, and
Absolutely.
that has to be our protocol.
Absolutely. I can't diagnose, I don't have the testing capabilities, and with the symptoms being the same, I can't make that diagnosis because I can't diagnose. So, if I say Johnny come to me with a headache, I know Johnny comes in quite often with headaches. He gets medicine, he goes back to class. If I assume that's one of Johnny's regular headaches, and I give him medicine and I send him back to class, but 2 days later he tests positive, then it comes back on me because I've just exposed an entire classroom.
I have a
Plus.
question. If they go home with any of the COVID symptoms, are they required to then go see a doctor to get checked, or do they just come back the next day if they don't have the symptom, or what?
It's my understanding with the guidelines that, we have to report to the health department any student that has COVID symptoms. So we would have to report that to the health department.
So, doing the math, say there's 10 students a day who if we had the same number of students this year as we might, there's 10 students a day who have some type of COVID symptom. They come to school, they have a headache, temperature, whatever. They get sent home, they are picked up by their parent or caregiver, they get sent home. They have to then go see a doctor to get permission to come back on campus?
Correct.
Lindy, is that your assessment? Is that what we'll be doing? You need the mic.
We will be trained by the health department and we will follow their protocol. If they have symptoms, my understanding is that we send them home and then mom and dad should take them to the doctor to be cleared. If they're cleared by the doctor, they can come back. If they test positive for COVID, they go into quarantine, and then we follow the health department's guidelines on who else may become quarantined.
Thanks. So every child that comes here, if they get a COVID symptom, they'll be sent home, they'll have to get a doctor's, they'll have to go to the doctor and be cleared, or be cleared by the health department.
That is my understanding.
Okay. Thank you.
Yes. Sorry, jumped in.
So that is my last question then on that topic. How, I don't know how many days can you be absent without a doctor's note to begin with? And I'm just thinking of Maggie's pediatrician, how many times, if, and again, I'm not planning necessarily, thinking we'll do option 2, but I'm just thinking how that would even be practical for so many families or kids. And I guess, and correct me if I'm wrong, but I thought on the health department's website, if you're referred for COVID, even if you test negative, you still have that 10-day period, that even then potentially everybody in your family has that 10-day period with their employers. I mean, how do we see that working?
Krista, those questions, I mean, those get deferred to the health department. The health department determines who is quarantined. If Blake has COVID and he tests positive, the health department will determine whether or not I'm quarantined. But those are decisions the health department makes with their contact tracing.
But as far as school attendance, if your child's sent home and they have to see their pediatrician has to decide whether to refer them for a test, or the health department is contacted and says they need to get a test, and they're waiting all these days.
Follow the guidance of the health department. And once again, attendance is flexible.
Okay.
We know that's an issue. We're not going to fail your child if they're out 20 days due to COVID issues. That is something we have to work with Ohio Department of Education on how do we handle attendance this year.
Chris, logically, I mean, I would think, and the administrators who are actually doing this could correct me if I'm wrong, I would think that if they're here, they're also doing the remote learning, and then they would just be like a permanent remote until they got cleared by the doctor. The thing that concerns me is the fact that you have 10 kids a day who are going to just be automatic home and for a while. So
Right, for several days.
but they should be able to do the online.
Yeah, okay.
They'll just, I would think, correct me if I'm wrong, but they should just flow into that.
So I just wanted to say, again, I know how hard everyone has been working, all of the board, all of the administrators. I know the concern of the teachers and all of the staff at the school. And I just want to say thank you for being the people that you are. I feel every day that when my daughter has come to the school that I have 8 parents or 10 parents who care about her equally as much and are looking out for her. And I know so many teachers at the school and staff would sacrifice themselves for our children and are willing to do that in this instance. And there is so much support for everybody in this school district and the work you do. And so I just want to tell everyone who's listening, thank you for everything that you're going to be facing this year, that you'll do for us and face this year on behalf of us. Thank you very much.
Thank you. Real quick, before we continue, it's been 3 hours. We're going to take a quick 10-minute break stretch and just take a quick break. We'll reconvene in about 10 minutes. Okay. Okay, if everybody will take their seats, or if you do want to address the board, please, again, line up at the podium. We will start here momentarily. Okay, we're back in session, and I see Miss Ball is at the podium.
Well, you know I can't leave without saying something. I've been involved in this, Sally Ball, Josh, in case you need to know.
Josh had
You knew that to
absolutely
begin
no question who was at the microphone.
I've been involved in this school district for 54 years. That's when I first started teaching here. So that's longer than some of you have been alive. We've been through a lot of different things in this school system, from a 52-day strike at one time. I know this is a lot different, but I want to thank this school system, this board, for I know the work they've had to put into this, the teachers, the staff. I don't know that I could teach online. Of course, I didn't know much about computers back when I was teaching. I think Lindy's done a tremendous job. I think what this school district needs to do is come together, work together, not be at odds with people. Parents have got to be involved. You know your kid better than the teacher in the classroom. You know if your kid is not feeling good, so why send him to school? It's not up to Teresa and Laura in the nursing office to say, okay, your kid's got this, your kid's got that. They can't do that. But you know your students. So you need to work with the school system and not be against people. And I know there's a lot of that going on in this school system, and I hate it. So we need to work together. Parents need to work with the teachers and get this school. This is the best school system in Athens County. I was told once by a board member years ago, any teacher taught at this school, if they could go to Athens, would go. And myself and another teacher said, no, we would not. And I never did. Mike Meek tried to get me there a lot, but that didn't work. So let's work together and get this thing going.
Thank you, Ms. Ball.
Hi, my name's Sarah Tuttle. I have an incoming freshman here, and then I'm an alumni of Alexander. I just have a quick statement, just especially for the board. There's lots of people out there watching today, lots of parents here, community members that care. We also have a lot of students here that have no one that doesn't care. They don't have anyone watching this. They don't know who the board members are. They haven't eaten a meal since March. And I'm really, really concerned if we do all online, what happens to these kids? And I know we can drop off meals in a tote. Not necessarily the mom's going to go get the tote. So I think it's super important that we consider them, and I'm going to get emotional. Super, super important that we consider them in this whole process. Because at least 2 days a week, teachers are going to set an eye on them, and we're going to know these kids are alive. They can download their assignments while they're here, and they don't have a voice. So that's why I thought it was really important that I at least stood up here. Before you guys vote, please, please consider them in this. Thank you.
Thank you, Sarah.
Hi, guys. It's nice to see you all. I'm Amanda Graham. I've got kids in the school district, so I have just a couple of things. I have some questions about how we're screening the kids. If we're screening the kids when they first get on the school bus for a fever, then how come we're screening them at school and sending them home for coughs if they don't have a fever? Like, there's like a breakdown there. If you could just get clarification on that, I think that would help with a lot of confusion right now. I don't know, maybe you can help me with that.
Because a cough is one of the COVID symptoms, so
But-
you can develop that at any time. I may feel fine today and have no symptoms.
No. So when the kids get on the bus, like, how come we're not, like, assessing them for those other symptoms?
They are.
Like, if you're caught. Yes.
But just because you don't have it in the morning doesn't mean that you won't develop a cough.
Teresa,
In the
do you
afternoon.
mind?
Can you use the mic?
I can crawl under.
Yeah, that math test is rolling around sixth period. Fifth, all of a sudden, got that stomach ache.
So I guess what I was saying is just because, in the morning you don't have a cough, that doesn't mean that 2 hours later when you're in school that you don't develop a cough. Or as far as a fever, you may not have a fever at home in the morning, but, at lunchtime you do have a fever. So that's why we have to, and that's one of the stipulations, that's part of our job
I know,
is
this
to
isn't easy on you
continually
guys at
assess
all.
that.
It's left so much to the unknown.
It
It's
is.
so hard.
Yes.
So that brings me to one of the things that I had to talk about is that we're the only school in the county that has an official Holzer facility on our campus. So why aren't we partnering with them to provide better support for this transition, such as moving our clinic over to their facility for better isolation as well, in addition to additional clinic staff provided by Holzer, the Holzer Healthcare Center? I mean, we have the opportunity to really do something wonderful here.
Thank you, Amanda. We've talked about that. We have Holzer support. Holzer on campus is a COVID testing site that we can access and the community can also access. I've had conversations with the higher up at Holzer at looking at getting additional nursing staff in our building for this fall through our wellness funds. Federal Hawking is also looking at that. Federal Hawking, unfortunately, doesn't have a school nurse, so they're also leaning on Holzer. So that's in the works, and we hope to have additional support for Laura and Teresa in the clinic that can help assist students and staff. The guidelines may change with the CDC, the guidelines may change with the health department, and it does need to be clarified. Lots of kids have allergies, asthma, headaches, and how do we differentiate? But that is something Laura and Teresa can focus on with the health department and see if we can get some clarification.
Yeah.
Lindy, a friend of mine went this morning to the Holzer Clinic, and they told her, she went explicitly to find out how and she works here, she wanted explicitly to find out how she could get a COVID test there, and they said, we are not doing COVID tests here. If you want one, you have to go to the emergency room. So somewhere, something is getting messed up.
Unless they're out of test cases, but I was told
that could be the case.
Yeah, they may be out of kits, but I was told that they are a testing site.
I think being out of kits is an issue. Many places.
It is, that's a good point. And then my last thing that I was just going to say is just to kind of echo what some other parents have said, is that full disclosure, if given the option, I'm one of the parents that will be sending my kids back to school. And I could probably stand here for 45 minutes and get all emotional and tell you why my kids need to be back in school. In addition to that, I would be lying if I said I didn't still have questions, like these lingering fears of what would happen if I sent my kid back to school. But I'm going to be honest in saying that sitting here for the last 3.5 hours or whatever we're to now, it is amazing how much the Alexander staff have been doing, like behind closed doors that none of the community hasn't been aware of any of it. mean, you guys have made wonderful strides, and the plans that you have in place, they're amazing. I sat over there and like all of my fears just lifted. I mean, not completely, you know, that's impossible right now, but so much weight just lifted because, you know, from a community member's perspective, it's kind of, a lot of folks have been feeling like Alexander's not prepared, they don't know what they're doing. But the staff, they really do. I mean, the buses and the cleaning, and so I just wanted to just make that note that you guys are really doing some amazing work, and you need to get out there and shout about yourself. So thank you.
Thank you, Amanda. It's been a lot of work, and the team here has been tremendous. Redesigning public education is how I look at it. It's not perfect, but we have a plan. We can tweak it. We can add more details. And we get 9 weeks under our belt, we can come back and readjust. We look at it, we study it, we make readjustments, and we move forward.
Sorry, just one last thing, because my phone blew up when I got back to my seat about people ask questions. My question is, if we go to all remote, will then all athletics be also canceled? Because I think we'd be hypocritical if we're saying our kids aren't safe in school, but they're going to be safe on a field, kicking the same ball around, wiping their sweat off. Naturally, even our adults on the field are spitting, whatever. So has that been talked about? Because I think, honestly, if we close the school down, that would be hypocritical to keep our athletics going. The other thing is a PSA, public service announcement, real quick. To reiterate what Sally Ball says, your teachers, your staff are here because they adore your children. They love your children. Our board is here because they care about our children. We need your help as parents to not send them sick, to keep them home, so that we don't end up having to turn around and close because they're coming sick. So I'm begging you as a staff person here, and one person who's going to be riding the bus with the students, if your kids are sick, please consider your teachers and the staff here enough to keep them home. And the other PSA is a good way to help with your masks is start having your kids wear them now. 10 minutes a day, 15 minutes a day. Just get used to it. Just get them used to it slowly and surely. It's the best way that they're going to be able to come prepared to deal with what they're facing with. And you wear it too. Wear it around them so they can get to see what your face is like when it's covered. PSA done.
Okay, Nancy, thank you. I know that we have had some informal discussions about athletics. I'm not prepared to make a statement myself tonight about it, but the choice that we make tonight, yeah, we will have to address all extracurricular, just not sports. It's all extracurricular activities. So I'm not prepared to ask the members to vote or even comment on that this evening, but it is being considered and debated on how to move forward, depending on how we move forward tonight. Is there anyone else that would like to address before we move on? Okay, this will then end our public participation for agenda items. Before we move on, I just want to say one thing, that for those listening at home, for those who took the time out to attend this evening, took the time to address the board, first I hope tonight's meeting was informative. There was a lot of information presented. I hope it provided help to us as a board for us to make an informed decision next. I also hope that it gave parents at home and in our district that same valuable information to make the best decision for you and your family. And I think we all respect here on the board that every family, every situation is unique. So again, I hope that the 3.5 hours of conversation has provided information for everyone here tonight to make a decision that's informed. So moving on to item number 5, superintendent's recommendations. Do we, as a board, do we have any comments ourselves, or have we debated and said our comments? Are we ready to make a motion and vote on item A?
I think there's still some discussion we need to hear from the department heads, Jay. For example, Carla mentioned earlier, this feels like internal stuff, so she cut herself off from going very further. I think there's more behind that. I'd like to hear more about our PPE status, what our actual supplies are like. We have focused on education so far, but this is a health and safety crisis, which creates a financial and educational crisis. So I would like to hear more from the department heads about where we stand, staffing wise, PPE, et cetera, et cetera.
Okay, I'll turn the floor over to those admin and union reps that are in attendance to answer that question, please. Okay, who has the hot mic? Come on. Josh, what's your specific question Carla wants to know for the union?
At our last meeting, Carla, you mentioned that the staff had 2 major concerns, safety and enforcement. I'm gathering as you were talking earlier, there's another concern, staffing. Are those the 3 biggies? Are there more biggies? And where do you think the group stands at this point?
So based on emails we received after asking the question, what are your top concerns that really affect staff, all teachers, not just me personally. Safety certainly is, health of our kiddos, other teachers, the rest of the staff, and our community, because this crazy virus doesn't just stay on one person. It tends to go everywhere. The other one is subs. And I don't know how to explain it. Maybe others can do this better than I can, but if you have someone out on a long-term leave, you need to find a viable teacher that can do that job. That means make lesson plans. We need to have those teachers here and learning what we all need to learn about Google Classroom to replace them. So if in a normal year, I'm guessing we have 2 or 3 long-term subs sometimes when we have, usually we use them for somebody taking off to have a baby. That's the biggest one, or a surgery. And that's sometimes difficult to cover, even when there's 2 or 3. I know of 13 that have come through my email system. Now, not all 13 of those may end up choosing to do this, but they are inquiring. They're serious about this question. I believe 3 of those have gone ahead and signed on the dotted line. They're going to be taking off. And these are because of exposure. They can't be exposed. They health-wise can't be. So on a typical day, I don't know, once every 2 or 3 weeks, I'll be asked to sub in a classroom because we don't have enough subs. So when you start thinking about that, and then most of our subs are retirees, they don't have to be doing this, and so the sub pool is much smaller. We just have a lot of concerns. You know, what if we come to school and there's, just not enough teachers? There's just not enough. And again, the administration has been really good about trying to come up with some clever solutions to do this now and then when we don't have enough. But my concern, and I think teachers' concerns, are that it's going to happen a lot. And then if you start taking into consideration, if somebody has to be quarantined for 2 weeks, all of those sorts of things. Does that help, Josh?
It does.
Okay.
Lindy, what's the plan if we have a lot of subs that we need and we can't get? What do we do with those classrooms that aren't covered?
Every school district is faced with substitute shortage. It does help us that Athens City Schools is not going to be open this first 9 weeks. All county schools work off the same sub list through the Athens MEGS Educational Service Center. We have to be creative. We have to figure it out. We have to go after our friends and neighbors that have 4-year college degrees that are willing to sub for the year. I have 3 resumes that have come in on emails that people have teaching degrees and they're looking for something to do. Mr. Raines got a phone call from an alumni, said, hey, if you need help, let us know. So it's up to the administration to be creative and get these classes covered. We've just got to know where we're starting so we can start laying more framework out there. Subs have always been an issue. When I called Jay back in February and said, I think we need to close, part of it was our student absenteeism tripled on a normal flu season. But the other part was staff. Staff were going down. How do we cover it? So through this COVID pandemic, there might be a point where I call Mr. Barnes and say, we're low on staffing. I think we need to go remote for 1 week, get everyone healthier again, and move forward. But we have some ideas of covering classrooms. I've worked with the non-certified union on this also. We'll put a plan together.
Can you elaborate on the plan or on the ideas?
Say that again?
Can you elaborate on the ideas that you're coming up with that are unique?
If we need substitutes, we would pull them from the substitute list. We would also look at the people who have turned in resumes with teaching degrees. If we need to lock in 3 full-time subs for the first of the year, we will do that, and then we will move forward.
I get that from the teaching roster, from the substitute list that you draw from. But you just mentioned you're talking with paraprofessionals and other staff. What ideas are those?
If we are short a teacher and the curriculum is laid upon the teacher's desk and the directions are there, we can always have an aide be in that classroom to facilitate and have students work on the work. The other item I could do is pull my fully certified PE teachers, who also are dual certified, and we can put them in a classroom and cancel PE if we have.
You already had established that we've maxed out the long-term sub by what's been committed thus far. So that means we have all the what-ifs to deal with. So I'm assuming that Lee and Melissa are there. How many on an average good day do you need subs covered?
Josh, this is Lucy. I was at a meeting yesterday, and the teachers union shared that I believe last year, generally from Tuesday, Wednesday, and Thursday, around 7 a day on average, and Monday and Friday were more. So that's last year what they needed. I think that was the
Combined?
whole school.
No, it was 3 to 4 elementary, and then 6 to 7 high school.
So that's like 10. Okay, so that's 10,
Yeah.
right? And then more on what?
That is correct.
Okay.
Lucy, you are correct. It was
Yeah.
6 or 7 at the high school level and around 4 at the 3, 4 at the elementary. And as stated, currently, I've been in contact with 13 of my 45 teachers who are looking at taking a leave. And as Lindy stated, we do have a couple resumes from past student teachers and one other from a local person. And then we have a couple long-term subs that we are looking into, but in one case, we know there was medical concerns prior to this year, so we do not know if they are willing to come back. That is a concern for us, and we have worked through some ideas. We don't have good answers, but we have answers.
Do you feel you have enough answers to cover the subs you're going to need during COVID time? And that's to start off with, not to mention when we have flu kick in also.
I think we've got some good
What was that
ideas.
question again, Josh?
I was asking, and thank you, Lee, I'm glad you stepped up there, because I kind of have the same question for both you and Mrs. Guffey. Do you feel you have enough answers to get enough subs to cover the COVID season that we're going to be dealing with? And that's even before we get into the flu season, in which case it'll be even worse. Do you guys think you have enough answers to be able to pull in that many subs?
We're scared that that's a big concern. One of the things, Mr. Sherman, I asked, there are some things in place through FMLA that try to get to your question. There are some things in place for the through FMLA that teachers can buy themselves some time. It's not a great long-term solution, but it's a fairly good short-term solution. I won't go into details about that because I would probably misspeak. I'm not sure how that works. One of the problems with that good solution for teachers for short-term is that there's not really a deadline that they're forced to tell us that they are coming or not. And I don't mean that in any ill way toward any of those teachers. They're trying to make the best informed decision that they can as well. So Melissa has, Ms. Guffey and Mr. Masquille have 13 teachers. Right now on our end, there have been 4 that have talked to me about that. So that's a little less of a pressure on that end for me. Certainly with substitutes, good substitutes, those are 2 different things. They're all hard to find. And so on a given year, they're hard to find. I am concerned about that. I have talked to multiple people as well. They're apprehensive for $100 a day, and we're one of the highest paying places for substitutes. I think Federal Hocking may pay a little bit more to get somebody to drive up there, but it's yeah, I'm worried about that. I think we're all worried about staffing, and yet we don't know the true numbers yet because no deadline is in place to help us with knowing how many people are going to take that option.
Thank you for your honesty, Mr. Raines. That was tough, I'm sure, to go through. So I'm gonna make it tougher because I'm a jerk. You just mentioned something that was really profound to me. There's subs and there's good subs. If we're scrounging and I'm going to use my own words here. I'm not using your words. So if we're scrounging to find enough bodies even to cover, are we still going to be able to provide an adequate education to the kids in class if we're really just looking for bodies at some point?
Certainly a concern. You know, we have a lot of qualified people here. I've got one qualified French teacher, got one qualified Spanish teacher. I've got a qualified, you know, when you get on that end of the building, people have specialties. And to replace, most of the time on a, to replace a specialty in that case, that's difficult in itself. So I assume these times, and I think we recognize that it's going to be more difficult, not to say that we won't try to do that, to make sure that we put good people in good places to be successful and be beneficial to the students that come here and when we come here. But I think that is, we would be blessed to say that is not a concern of staffing when we're, as again, we said we're shooting at a moving target. This is a blind, like we're blinded by this. And we're given some heads up, but I don't think that I understand where these people are in their delay, and I understand where they are in making their decision. They don't, but right now, that number's kind of scaring us because I guess we're envisioning August 30th, 12 people coming in and saying we're not coming back to work.
One of the things that many of my staff have come across and said is one issue. We do have medical issues, and those people, again, have let me know about possible leaves. But the other part to this is exactly what some of the parents were saying, which is it goes back to childcare. And having two working parents, and if we're on blended, we have teachers that are parents as well, and their students will be either at home and have to do remote learning without them while they teach others, or they have to make the decision to stay home. And we've talked about this, and we said in every situation, in every household right now, people are having to make some really tough decisions about what's best for my family. And with that being said, we don't have a good answer for that. We've brainstormed things, even yesterday at the meeting that Lucy and Blake attended. We had ideas on the table, but if we can't resolve that is why our numbers are so high, because we have a young staff with young kids, and we have other staff that are taking care of their parents who have health concerns. So those are the issues when it comes to the staffing piece.
Josh, this is Rich. I will say that we have looked into sub numbers for this year slightly. I say only slightly because we've had so many meetings. It hasn't been one of the things that I've been able to delve into, but I did email the subline asking if she had heard of sub numbers for this year, if there would be an increase or a decrease based on what's going on. She said she did not have that information right now. Looking into calling the Educational Service Center, but with all of the other meetings, that just hasn't been able to happen yet.
Thank you, administration.
I wanted to say something as a former sub. First of all, the teachers are not expendable. We're talking about people in our community. We know people here it's not a question of if, it's a question of when people will get sick. And it is a staffing issue, but I want us to also remember that these are people who went here, they're people who live here, and people who have kids with our kids. So I think it's our job as the board to look at things long-term. And I think it's helpful to remember the difference between 9 weeks and the rest of the year. What we're talking about tonight is only for 9 weeks. And to me, maintaining adequate, able staffing is super important. We could have a paraprofessional sit in a room with kids on Chromebooks for a day or two, but they can't do lesson plans. And you can even hire subs to come in, and subs can't do lesson plans. So I want us to be real careful that we're talking about people in our community. Carla, my question is for you. For the people who are thinking of not walking, the staff members, teachers, who are thinking about not walking through the door, is it a question, do you think if it was 9 weeks without them having to walk through the door per se, well, they'd still be in here teaching, but 9 weeks only remote learning, and then we could see what happens with other districts that have done a 2-3 model, and assuming the other districts were fine, would that address at least some of those folks' fears? If it's just 9 weeks?
So let me be clear, it's not about fear.
Worry, it's all legit to me.
So, you know, if my doctor tells me I should not come to school because of my health issues, I really need to consider that. So is there fear out there? Sure. But most of these leaves, I believe, are not that. It's, you know, if the case is they can't be in the building, certainly they can do remote. And I think we all will know a lot more in 9 weeks. So yes, that would help a lot to alleviate the sub situation if we were on remote. Is that kind of getting at what you are asking?
I'm not sure.
I can't speak for people whether or not they'll know enough in 9 weeks to find out whether or not they could
Yeah,
be
that was
here.
my question.
I don't have a ball that tells me, shake the ball, yes, it'd be fine, I don't know. Yeah, it's a lot of different individuals. They all have come at it from different reasons, different ways, so I really
And I know
really
some have
don't
family
know.
members who they're really concerned about too.
Yeah, absolutely.
And just to throw a fly in the ointment, as more and more schools are choosing entirely remote, it also does impact our ability to watch another school, see what they're doing, and react, because more and more schools are going completely online. So I don't know that in 9 weeks from now we'll be able to say, we watched what they did, that worked really well, we can implement. There will be some schools to look at, but I don't think there will be as many as we thought there would have been a month ago.
Oh, there's Google. We can find schools somewhere. And another point about subs, I was speaking with, I've had a lot of conversations recently, and I do want to thank everyone who gave me an earful. They were all very nice and thoughtful and very clear. The issue of subs is not just with teachers. There's other staff too. I mean, I was a sub here, but if there's one job I would never want to have to do, and that's a bus driver. Maybe folks are not worried about if you need to replace bus drivers, get sub bus drivers, but I believe the issue of subs is not just with teachers, it's with many staff.
So I already got a text from a teacher, yes, 100% better in 9 weeks.
What?
They would feel 100% better if they if we had 9 weeks to figure it out a little bit more.
So that's 1 out of 13.
1 out of 13.
Okay.
One concept that has come up several times over the last, since the last board meeting, with Plan C and also with having the online or the remote portion taught by Alexander teachers, which was a change from what we had originally talked about and one I'm wholeheartedly happy to hear. But one concept that's come up a number of times is a teacher looking at it and saying, gee, my load is now doubled. Teaching in person is one way. Teaching online remotely is another. So for Carla and for Melissa and Lee again, I guess, is that a prevalent thing that you are hearing?
Carla's hearing from another teacher, I think.
Yes, it's a concern. Not for everybody because it depends so much on what grade that you teach, whether you're in a specialty class. At the high school, it's really different than at the elementary, so it's all over the place. It is a huge concern for some teachers and less so for others.
Josh, Lee here. That has been something that we certainly have heard from the staff. We've had a couple of, from the 6 through 12, we've had a couple of BLT meetings. That's been a discussion. Some of it can be maybe eased on their mind with the extended calendar for training. I think they did, that's one way that I think that they're tackling that concern. Certainly another one, is that it is a different strategy, a whole different set of materials and how they're going to implement that. And I think they need time to digest it mentally, and they need to practice, and they're going to be using new forums to do so. We're going to require some sort of web-based forum for them to use. Not all teachers have used that. Google Classroom or I don't know, Brian's a lot better with all the acronyms than I am, but it is a new way of teaching, and it is a concern on their behalf. Trying to help them ease their mind is giving them more time and more professional development. I think that's a good question for ALEA and their teachers, to each teacher to answer. You'll have a lot of different answers from them as well. Many teachers are ready to go back 5 days a week. Many teachers want to start remotely. It's like any other question that we ask. I think you've got a pretty good sampling across the board.
Brian, we'll let Brian discuss facilities here.
All right, this is Brian from Facilities. Well, I got asked by Mr. Reagan yesterday how much hand sanitizer you think we'll need, and it's really hard. I can't answer that question, but I can answer what we used last year. I ordered 10 cases of 14-ounce pump bottles that have 6 in a case, very little, and 228 gallons of hand soap. Now, this year, as far as hand sanitizer goes, it's really opened up lately. I can get quarts, as many as you want. I can get 8-ounce bottles, 12-ounce bottles, 14-ounce bottles, a gallon bottles. I can get all the hand sanitizers you want from like 4 multiple vendors. All the ones for the buses are here, so we have 30 dispensers they're going to install on the buses. There's enough refills for 3 times on every bus.
They're actually here? 'Cause
They're
yesterday-
here. Yeah, I just unloaded them today. I put on the email earlier that they was coming, but they showed up today. The Fastenal is coming. I talked to her. It's coming next week. So there's 30 dispensers and 60 gallons of sanitizer that I plan on installing. A long time ago, we had to take all the alcohol hand sanitizer out of the school and put non-alcohol based on the health department and the state of Ohio recommendations on Jarrett's Law. So they was all removed, non-alcohol was put in the schools. Now with this changing, now we have to switch back to alcohol. So last year, the elementary was done, and they had an issue with bags leaking, so we stopped. So from 6th grade on, still has the old dispensers. I have plenty of refills for the elementary. The high school, I'm getting the ones from Fastenal. We're gonna start putting them that way, and then piece in what I can. So sanitizers, I think we have plenty. Clorox wipes are tough. I mean, they're tough at town, they're tough everywhere. I do have 60 cases coming from a company called BDT. They're made by Echo Labs, same thing as Clorox wipes. He said they're just getting a semi-truck, and then he said there should be no problem to get it. It's starting to open up on Clorox wipes now because I've had some on back order for a while, and they trickle in little by little by little. So that's tough, right? So one of the ways that you could do this, and I talked to a couple other schools, what they're doing is the same thing that I proposed, using our chemicals, which is Oxyvir, hospital grade disinfectant. We used it on MRSA and everything. We've had it here for years. We typically haven't used it on tables and desks because we have another product called Triad. It's not as strong as the Oxyvir, and the Oxyvir is a little more expensive. So what they're going to do is use the high dollar chemical and use paper towels. I said microfibers. They're going to use paper towels and throw them away. Or the microfibers, how we clean the kitchen or the cafeteria with wands, microfiber spray, wipe, spray and wipe. And we do the entire cafeteria and then get rid of the pads. So if you're only going to have 10 or 12 desks in a classroom, they should be able to have one pad that'll last for the entire day. Spray, clean it. I mean, the disinfectant kills within like 15 seconds. It's good disinfectant. This way we keep it off of people's hands. If you start using paper towels, right, you can worry about people getting on their hands, not gloving. Some people have a little bit of irritation from it, but it's in a proportioner kit that comes in a bottle. You get 10 gallons out of one jug. I have over 44 jugs, so we have more than enough to last quite a while. So when this all went down, I started ordering as much stock as I could get ahead of time versus waiting for it. So, and like we have the other chemicals we have the Triad. It works. The thing is, it's just not as quick a kill as the Triad. So like in the daytime when we're going to have bus drivers helping us disinfect bathrooms, door handles, stuff, handrails, during the day we're going to use Oxyvir and use it to clean off because it's 15-second kill time. So that's the chemical we're going to use. I also have 2 Protexis spray guns. I know it's not on here. We used during the flu season when people said that we didn't know how to clean, right? It's a misting aerosol mister, electrostatic, supposed to wrap around products. That's how they sell it. I have 2 of them. We've one down in the high school end, one in the elementary end. We've used it to spray desks, and it supposedly wraps around stuff. This is how they sell it. It's a little tab called Puritab. I have like 3,000 of them, and it lasts quite a while. I can do every locker in the entire school with one tab. So that gives you an idea of how long it lasts. And a lot of times people don't realize, but in the morning as school starts, I just walk the halls and spray as I'm walking, right, checking things, and that's how I do it. So as far as PPE on hand, we have 5,600 disposable masks, 400 KN95 masks, and both of them are pretty readily available. It's not hard to get them at all. It's a phone call and a PO. We have 400 face shields, and they're easy to get also. A lot of people were making them. And I have over 1,000 gloves of each medium, small, medium, large, and extra large, if anybody needs any gloves. And the health department gave us 100 disposable gowns. They're just thin plastic gowns if somebody needed them for the clinic, and I don't know where anybody would else want to use them, but we do have them here too.
Do you have different size masks? I'm just thinking of a 3rd grader trying to put on the same mask as.
I'm sorry?
Do you have different size masks in the PPE? Do we have like, I don't know if they even
Well,
make.
we have only one size. You buy them, they come in one size. The size that Miss Douglas is wearing and Lucy's wearing, it's a disposable surgical mask. That's all they sell. There's not any sizes on them at all that I've ever seen.
So, okay.
Is that what you're asking, the sizes of them?
Yeah, I didn't know, like, I'm just thinking of the 3rd grader.
No, I get that. I get that. A
mask.
smaller one would be better, but I have never seen anyone. I've only seen one size on the surgical mask. Have you ever seen any different sizes on the surgical mask? I've
Do
only
they
seen
make?
one.
They
Do
make
they
them.
make
There are
clips?
smaller ones. We've had to buy them for our kids.
Okay, then maybe I'll look and find some.
A full-size one pretty much covers a fifth grader's
Well, yeah, I'm
face.
sure. Like I said, I just know that I can get masks readily pretty quick, and the only thing I've ever seen is the big ones, but I'll look and see if I can find them.
Yeah, those are pretty difficult to get a hold of.
Okay, but we do
At least
have,
in our experience. So so you're having good luck, Brian, getting those disposable masks in?
yes,
in general?
there's a company that, actually the lady who went to Southern schools in Racine that sent us thing, and they've got masks, and she said she has way more than enough in stock.
Okay, because we're going to need way more than 5,600.
Well, yeah, and that's not, yeah, it's easy to get.
The gloves, just out of curiosity, who all dips into that supply? That's not just the clinic, right?
No, it's not
custodial
just the
staff.
clinic. Actually, the gloves that I have, the clinic she orders her own through a different company. The ones that I order through my cleaning supply company. And most of the people who use mine would be a paraprofessional. They use them when changing a child. Some of them children that they have to change. We custodians use them. And then Teresa orders. How many you've got? Teresa's got a supply in her clinic now.
10 cases,
She's got 10 cases that they use just for the clinic.
10 boxes, one case, 10,
Oh.
10 box in a case.
One case is 10 boxes of 50.
100.
10 boxes of 100 is what she has in there for her.
And those are reasonably available?
Yeah, I haven't had any problem getting any gloves.
Okay.
That's one thing that we haven't had any problems the entire time. Like I said, Clorox wipes is the hardest thing to get.
But from the signs that there's no need for Clorox wipes when you got, I don't even want to try to pronounce that oxy, whatever thing you said. That
The
one.
Oxyvir, yeah, it's a solution. We've used it here for every athletics. We've had MRSA in the past, and we do it on weight equipment. We've never had any issues. No, the biggest thing is it runs through proportioner. I know Athens had that problem last year, right? They incorrectly used it straight, right? As long as you proportion it, it's not bad at all. I don't know the safety risk on it. I mean, you know what I mean? I don't know what the SDS sheet says, but it's not that bad. It's what we've used it here. Since this all started, that's what we completely switched to. Everything's being done with that.
Would you be comfortable handing a squirt bottle to a teacher to wipe down desks?
I would. And honestly, because Mr. Raines and I have talked about that, right? Class changes in the high school. Even if I have bus drivers, there's like 48 classes that change between 6, 7, all the way to 12. You could never have enough staff in a 2 or 3 minute interval to even try to get in there. So yes.
So what about a high school student to wipe down their own desk? Is it something that you'd feel safe with an elementary?
I do.
You would?
I would.
Okay.
And like I said, we're going to get the microfiber things with pads on them, right? There's no touch spray, just go right across the top of the desk.
Thank you.
Anything else?
Hi there, I'm Teresa Stolder. I've already been up here and spoke once, but I'm the nurse. I'm a registered nurse, so I'm the nurse here at Alexander, and then Laura Bean is here. She's my the health clinic aide. I'm probably going to say one opinion that I have here that I just had noticed, and just being a medical professional, I can't help but just kind of show kind of what we're going to be looking at during the school day. So when we were on the phone conversations with the lawyer's office and Mr. Pepper, we had one cell phone, and it passed between 10 people, and nobody sanitized. And then we've been touching our face. We have a microphone that we've been passing back and forth. That's what our teachers are going to have to be, looking at, because we're adults and we still just don't think of things like that. So, our staff's going to have to be diligent in making sure that, our children are watching those things. So, it's probably not a popular statement, but just something that I had observed. So I kind of just prepared, Laura and I together, prepared a little statement here. And first and foremost, we want to say that we appreciate being asked to come tonight to kind of, voice our views. We applaud the administration, the school board, and everybody involved for their dedication, hard work, and the countless hours, days, weeks, and months that you all have put into the reopening plan. We were contacted last week in order to kind of work through the reopening plan, and we've been working on it ever since, trying to iron out all of the ins and outs with it. And just understand we are approaching it purely from the medical, health, and safety rules and compliance perspective. So first off, it's not up to us to judge, or determine what we think the safety risk involved is. The Ohio Department of Education, Centers for Disease Control have already done that. Whether we agree or disagree doesn't matter. They've already set those guidelines. They have created the rules and guidelines to be implemented and followed by all school districts, which they feel will keep the students and staff safe upon return to school in the fall. It's our job to implement and enforce those said rules, guidelines for our own reopening plan. If we cannot implement and enforce the rules, we cannot keep the students and staff safe. If we cannot keep the students and staff safe, we cannot and should not bring them together in one building. As your health clinic staff, we are now responsible for creating new health policies, procedures, and protocols as part of the reopening plan to meet all the nursing and medical requirements set forth by the ODE, CDC, along with the Big 8 Health and Safety Coalition, the Ohio Department of Health, and the Athens City County Health Department. All of these procedures, policies, and protocols that we create must not only be followed, they have to be executed fully and completely to be in compliance. We would love nothing more than to see the students and staff here in the building. We understand that in-person learning is the optimum educational choice for most students, parents, and guardians. We make a health and safety plan to be able to do, but the question is, do we have the staff and resources in place to implement and enforce it completely and fully per those guidelines? We must follow the health and safety guidance for Ohio K through 12, and it states we are to vigilantly assess for symptoms. Symptoms can range from mild to severe: fevers, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. It also states the following: if a student, staff, or volunteer begins to show symptoms or has a temperature above 100 degrees Fahrenheit while at school, they must be immediately separated from other students, staff, or volunteers, be given a face covering if they don't have one on, be monitored by a staff member who is wearing the appropriate PPE while maintaining the physical distance when possible. The space where the individual waits before he or she goes home should be separate from the nurse's office and other areas that students are likely to visit. Areas of the building that were occupied by a person exhibiting those symptoms should be thoroughly sanitized once they leave. School personnel must refer to those displaying symptoms of COVID-19 to an appropriate healthcare professional or the local health department. Local health professionals can help to identify potentially infected or exposed individuals and assist with appropriate notifications. Individuals who potentially have been exposed should follow quarantine and other recommendations from the local health department or their medical provider. We are not licensed physicians and therefore cannot diagnose With that being said, anyone displaying any one of those listed symptoms will have to be sent home. In a typical non-COVID school year, we see an average of 75-plus students a day. On an average, 40 of those are displaying one of the COVID symptoms. This alone could lead to a very limited number of students and lack of staff available to be permitted in the building within a very short period of time. In closing, as your health clinic staff, we are not qualified to address if the educational standards in the reopening plan are being met. We are, however, qualified to determine if we can meet the very strict and mandatory health and safety rules and guidelines. After speaking with numerous other health and safety professionals and taking into consideration all of the guidelines mentioned above, it would be very difficult to meet these guidelines if we don't have additional resources and properly trained staff. I don't know if anybody has any other questions, but.
Thank you.
Yes.
Lindy, had you said earlier that you would be getting additional resources? Can you say again what those were? An extra nurse?
Microphone.
Additional resources, yes. We're working on an additional nurse for the clinic, additional space for the clinic. We are also having additional cleaning staff during the day, and Brian is stocking up the PPE for us.
But right now, we do not have, you said you're working on getting an additional nurse, but nothing.
That is in the works. I'm working with Holzer. We've got 30 days, but he's working with us and Federal Hawking to come up with 2 to 3 more nurses for the school districts.
So we get a whole nurse and they get a whole nurse?
That is our intentions, yes.
So the plan has changed from a 20 hours per week nurse from Holzer? We now have a full.
We are working on that through Holzer, 20 to 40 hours a week. If the board wants to go with a full-time 40-hour week nurse, I will request that.
The first question I would ask would be to Teresa. We're talking about a grand total of 3 people. Is that adequate to cover what you need, or is that still short?
She's walking to the mic. I know you can't see.
I'm sorry, you can punch me in the nose next time you see me.
That's quite all right. To be honest with you, it's depending on how many of those kids we see that have a headache. You know, if it's anything like a non-COVID year, with the clinic staff needing to go to the classroom to get them, it could prove difficult.
Another option is if we're only bringing in half the students, and this goes on to additional planning, if we're only bringing in half the students, we will have aid support. We can relocate aides. If you need an additional aide in the clinic, you need to let us know. But we should have flexibility with our aide staff.
To be the runners to go. That's my thoughts is, you know, let's just say Laura's in the COVID clinic, and so is the other nurse. I'm in the well clinic, taking care of the diabetics and that type of thing. But then we have a elementary student who has a headache. So Laura's going to that classroom to get that student, but then we have a high school student who has a headache because they can't walk down themselves either, because we need to know that they're going from point A to point B, that they're not possibly, you know, infecting things along the way if it is a possible COVID, you know, symptom. Then that leaves nobody in the COVID clinic. So that, I mean, that in lies my, concern as far as there's nobody there, I'm in the well clinic. There can be tons of different scenarios, and it's a lot of what ifs. I could get called out for a student having a seizure in the high school. Nobody's in the well clinic. So, we would have to have people that would be able to go to the classrooms to bring those students to us, where we would be able to be in those areas and not have to leave.
Are the COVID clinic and the well clinic two separate spaces?
Yes.
Guide me, where are they at, please?
So, pardon me?
Do you want me to do it? What we've talked about is we are going to move the workroom out. The junior high workroom will go into the teacher's lounge. There's plenty of space there. That whole unit where the clinic is, there's three or four small offices. Those who can become quarantine rooms. So the well clinic will be the clinic as always. The 3 to 4 offices down the hallway will be the quarantine rooms, and then the junior high workroom will become the COVID clinic. So it's all in one unit, but it's separate.
Do they have separate ingress and egress?
So we could actually kind of turn it completely. We've talked about doing it two different ways. One is what Lindy just said. The other one could be the health clinic now, could be the COVID clinic with the offices as isolation rooms, along with, we could have isolation rooms back where we have cots for 6 students on a non-COVID year. The teacher's workroom could turn into the well clinic because there is a sink there to where students could, get their water for their medicine, wash their hands, and that type of thing. And then there is a door that separates those two areas, and you can walk into what is the teacher workroom from the hall on one end, and then walk into the health clinic, or what would be the COVID clinic at that point, down the hall on the other end. So neither would be going in to the same area.
Is there, I'm just thinking of, like, we're talking about, it's been a while, about somebody being left there possibly all day. Is there a restroom available?
Yes. Yes.
Okay.
That's important.
Yes.
This is off the room issue, but if anyone else in the school system gets COVID symptoms, they're probably replaceable. But you and the other nurse, Laura, probably, we have to be super, if you folks were in contact, how do we you'll have people who are possibly COVID.
Mm-hmm.
We'll have to be super careful with both of you
Mm-hmm.
and the extra person if there is one.
Right, correct.
So we'll have to also be tapped into a visiting nurses person if you get in close contact with anyone, because then you're out.
Right.
And you can't do your job remote.
Right. Correct.
Josh, have you heard from everyone?
I think I have, no, I'm sorry. One more person. It's that guy clear over on the right of the camera from me. Wake him up. Aaron, we haven't talked a single question about how much this is all costing us, nor how much it will cost us. Not one discussion have we had, and this is something that normally Jay and I are just beating on like crazy. Do we have any estimate at all of what is being proposed is going to cost us?
I mean, it's on. Josh, can you hear me?
Yes, I can.
Can you hear me? Okay.
Yep, yep.
I mean, we don't have good numbers for how much it's all going to cost because there's still so many unknowns. Just the other day, when we were in our meeting, and they started talking about Clorox wipes and how many Clorox wipes we were going to use in a day, and I just got my phone out and started doing the math. I was like, that's like $2,000 a day in Clorox wipes if you guys really use that many Clorox wipes in a single day. But no, I don't have any hard budget figures until we really know what we need to order. The stuff that Brian was referring to, all of that stuff's already been paid for. What I can tell you is I'm not sure if you heard or not, but we did get another $95,000 from the state through the federal government for safety equipment, safety and cleaning materials, anything related to coronavirus, distance learning. So obviously that helps. And that's in addition to the $400,000 that we had already received from the CARES Act prior to that. So there are some funds available to help offset the cost to a lot of this stuff.
Do you have any feel for where we are to date?
To date, we have not. I mean, to date with the stuff that we've already purchased, we haven't even put a significant dent in the $400,000 to even come close to the $95,000 additional dollars yet, and that's even taken into consideration the Chromebooks that we've already purchased through the CARES Act funds as well. So far, you know, we're good, but the cost could rise and continue to rise. We just don't know. Because the other thing that determines what are like masks. I know there's something was mentioned the other day about providing masks for every student every day. Well, that's a different cost than if you're just only going to be providing masks for students who forget their mask or who lose their mask or mess up the mask that they brought that day. So if you don't, specify what your objective is, then it's hard to put a price tag on that. Because if you're going to provide a fresh mask to every student every single day when they come in here, that's a completely different cost than just providing one to those who forget.
Okay, Josh?
The prosecution rests, Jay.
Okay. So is everybody said their piece, said the questions?
Just quick question. I know that a couple people have talked about addressing the wordage in some places in the plan. Are we going to discuss that, or is it simply what's there, we vote?
Okay, for sake of time, is it something that we can agree that we want changed?
So are we able to vote on it when we're still making changes, is I guess my question.
What was the response, please?
We can review those adjustments. If Blake wants to read them to me, then I will make those adjustments.
I guess I would prefer, Blake, if you want to make a motion, but list the changes, I think that would be the proper way to address those, that we could vote if you would make the motion to adopt and change the wording.
Jay,
Yes,
I
ma'am.
have a question about some of the, I'd like to back up a second. Under learning options, it has here, it's the superintendent decides when we reopen, and it closes at purple. I really think that needs to be closes at red, if we're going to even consider this plan. And I'm not sure I even,
Okay.
I mean,
That's something that we can do. That's one of the reasons I specifically asked Jack tonight what his recommendation was. So if we're relying on Jack's recommendation, not to tie it to the color code. But, yeah, I mean, that if it's a concern, it's not in the plan.
it's a concern for me, because to me, the difference between red and purple is that at purple, our healthcare system in our county is getting slammed harder. And at red, it's not. So if people get sick from our district, they're going to get into a system where they're waiting longer to get diagnosed, to get tested and everything. Either to me, I would take out the tying it to a level or put it to level red. And it's just, to me, the question is not going up and down colors to the 1, 2, 3, and 4, A, B, C, and D. To me, we're open at red, or we're open, if we get red, we close for 2 weeks, and then once it goes back down to orange for a week, we open back up again. I do like actually being tied to, we're connected to the healthcare system. I would like us to be tied to whether or not we're open or not to the healthcare system.
It's been 3 hours since we spoke to Jack, so I don't dare ask him to call back for clarification.
We don't
But-
need to ask him about
But I
this.
can't
What do we
remember,
feel?
to your question specifically to him, I don't remember him saying that the color code is tied to our capability as the county health capability. I didn't hear him say that. I could be completely wrong. I mean, like I said, it's been too long ago. But I think you had asked that question at the end, correct?
Yes, and he said that he is expecting to get slammed, and his staff is expecting to get a lot of pressure, just like they felt a couple weeks ago. When we were almost at
Did he say he felt they had the capability to handle that? They'd taken on more staff, and he explained where it was
Yes,
dispersed.
but he also, and I was trying to pin him down on, does that increase the amount of time that people have to wait to get tested? I know right now in the state of Ohio, there's a shortage of tests. There's some type of agent that they're not getting enough of. So I'm just worried that when folks get slammed, where our folks are going to be in line. And they should be in line. That's not a priority question.
Okay.
I guess I'm
It's a
going against
concern.
his recommendation.
Okay. So at this point, I mean, we cannot move forward without someone making a recommendation one way or the other. So, I mean, I'm going to ask for someone to make a recommendation. Blake, if you want to make one, Lucy, if you want to make one, I mean, not that I'm trying to push this, but I mean, as we get closer and closer, we can sit here and debate the details of one little line of wordage until tomorrow morning. We need to vote.
I can make a motion just as much as you can.
I
So,
can't hear you.
I said, no, I'll throw that right back at you and just say, I can make a motion just as much as you can. I'm not comfortable with the wording and saying that we'll fix it. So if somebody wants to make that motion, they're more than welcome, but it won't be me.
So, Blake, you don't want to make a motion with your corrected wording? No?
I think there's enough edits that need to go into it, Jay, that I think the most you could try to do with this plan is to, in concept, adopt it with the caveat that there's a good bit of edits that we need to huddle and put into it. There are sections in here that are missing as far as the ODE guidelines, the restart and whatever that proper phrase is, the reset and restart, I think it is. They're simply pieces that are missing. And we're not going to do that tonight. We're not going to be able to do that.
Okay.
So if the desire is to vote on this plan, we can do that with the caveat of edits to be had, but I don't think it's adequate. I don't think you're going to have I don't think it's adequate as it sits. Yeah.
So Aaron or Lindy, admin, jump in here for just a second with this question, because I don't know the answer to it. So we have been asked to approve this reopening plan. And so if it gets voted down tonight, what do you guys do? Admin, talk to me. Lee just says punt. That's exactly his motion is punting.
I don't think the idea is that we're voting it down and saying it needs work. The wordage.
Yeah, but how long, I mean, we as a board cannot meet with more than 2 people. So we're going to have to basically set a special meeting almost immediately. All of us give the administration what we want to see, and all of our little words that's so important to us.
I agree,
that's
Jay.
what we're holding. I mean, we're holding up families in the district. We're holding up the admin to decide how we're going back to school in possibly 3.5 to 4 weeks. We've had a special, we moved this meeting up so that we could make a decision. But are we leaving it? I'm just going to play, I always preface every conversation I have with Blake as what am I going to say? I play.
You're going to make me mad.
I always play devil's advocate. And so I try to look at both sides. Yes, admin presented this to the board. Yeah, we're the ones that's going to vote it up or down. But is the board the one making the plan here? I'm just asking the question. I want Lee, I want Melissa, please tell me what happens if we vote no this evening.
I can make an alternative motion.
Well, if you would, Lindy, humor me. I want to hear from our 2 building principals. I want to hear what they have to say.
I think I can start off. Lee noticed earlier, he said, you're wearing the necktie, so you should answer the questions. So in respect to his genius on the no necktie call, I guess that's where we are. I think some of the gaps in the plan are it is hard to make a definitive plan when we don't know which way we're going. So it has been hard with the district plan and particularly with building plans to put a whole lot of details in without knowing, are we going C, are we going D, are we going B? And so that is a concern, and we are way behind the 8 ball. And I think the admin team as a whole is pretty flexible with what the board would like to do, but I do think the longer we kick that can down the road, the more issues that we open up, because we're not having time to create and vet a good plan before students are here.
I'd like to make a motion at some point.
Okay, Lucy.
That we open with D.
That what?
We open with D.
We open with D. So, Aaron, you're the keeper of procedure here. Do we have to vote on A first?
I don't believe there's a motion to have A yet.
But do we need to vote yes or no on the recommendation? What's the clerical procedure here?
You should vote on the recommendation first, and then if you want to make an alternative
Okay.
motion, you
Okay.
could make one after you vote on the recommendation.
Lee and Melissa, I'm still not going to let you off the hook.
You're asking, your question was, what does this do to our, if we don't make a decision at all tonight, what does it look like for us?
No, I mean, if we vote down the plan that's presented to us, we haven't approved a plan, period, correct? We haven't approved remote, you haven't even presented a remote plan to us, is that correct?
I don't know that there's been one presented. I know we've worked on a remote plan, and we've looked at other schools' remote plans and what they're doing. I don't know if it was
Right.
presented.
So my point, and Lucy, it's not, this is not a criticism, but we have nitpicked this plan tonight. To make a motion to vote on a remote plan that's not even been presented to us doesn't make a bit of sense to me. I mean, it does address a lot of concerns for people who do not want to send their child back to this school. But using the same concept of this plan is not well thought out and has a lot of gaps, I've not seen anybody talk about, for the most part, what a plan for remote looks like.
Then we give them 5 days and they come back.
That's what I'm asking. By us punting for another week, what does that do to you in the start of school?
What we're shooting for. Like, I kind of feel like we're working up to get a plan that you guys sound like you need to make a plan.
What's that, Lee?
I kind of just feel like, whose decision is this going to be? You guys have said it's yours, and I agree. I'm not sure how to make a plan without, we've had input from board members. I know you can't have more than 2. We've had board members at DLT meetings to try to be a part of it. Makes sense, Jay, a little bit of what you said, how we haven't seen a remote plan. I don't know that you've seen really what any of those plan looks like in great detail other than that A, B, C, D. That's really what is that what you saw?
I'd just like to add in there, that's exactly what we did at the last board meeting. Just saying, when we adopted C, we adopted a sentence. So I don't know how you don't, when you did 2 weeks ago.
Say that?
2 weeks ago, when we voted for Plan C to start, we had a sentence presented at us 6 hours before or 7 hours before we came to meeting. And you had no problem voting. Now, my understanding is Plan D is option 2. So it has been vetted. It is planned. So to say that you can't vote on a plan either way, and that is put out there, that plan is there, and the history is there. So either way you look at it, that argument doesn't stand.
Okay, the only, the avenue that I'm coming from is that, yes, 2 weeks ago, we voted to go 2 and 2. That was the board's preference at the time. And then it was, come up with a plan, which is what we're discussing tonight. Now, if this votes down and we vote to do remote, all my comment is we have a detailed plan or an undetailed plan, whatever you want to say. You can poke holes in it all day long. I have nothing in front of me that gives me what the actual remote plan looks like. How do we, so now my concerns are, how do we address the lady in the audience about who lives in Columbia Township and their child has no internet? How do we, so all of the questions that we're poking holes in the 2 and 2, we still haven't vetted those out just like we did tonight for remote. But to the admin team and to the teachers, we owe them something. So I'm just asking, is that consistent?
I understand what you're saying. So are you, what I'm saying when we adopt something, is it allowable to adopt something that we are going to change? I mean, we directly contradicted it I think three times this evening. So yes, this plan is a good start. I'm with you that this, but what is the point of making a motion and adopting something that we're changing? I can tell every administrator, this is a good start, but it's a start, it's not a finish.
Then
But
I
it is a-
suggest we have a working session where the board, have a special board meeting where the board is with the administration and you finish the plan. You need to be there. If you look on page 2 under teacher expectations, that's what falls into the remote learning plan.
I
How do
don't
we
need to
do
be
it?
there. I need your plan where you said just earlier, this writing says that the IEP meetings will continue to be held using conference call technology. That's what this plan says, and then, I don't know if it was 4 hours ago or 3 hours ago, whatever it was, you directly contradicted what your writing says. So whatever it is that our plan is, this has to say. When we approve this, when somebody doesn't come get picked up, we're going to send them home in Child Protective Services or with a sheriff. We're going to change that wording. So why don't we just change it and approve it? I'm good with telling every one of the administrators that this is a good start. Keep it going. You're heading the right direction, but I'm not ready to approve it.
Do you want to strike that language out?
But that's why I asked you, do we need that language in there to approve for this? Do we need that language in there?
The microphone's off again.
Lindy's microphone's not on.
Blake, if you want to walk through those items that you want edited, we can do that now and approve it with those edits, and then we'll make a published copy.
But that's under the assumption that those are the only 3 edits. What I'm saying is that through our first conversation through this, we found 3 things that need changed. What does approving this document give us that needs changed? What are we awarded?
I think what it gives us is the ability to move forward with a plan, and I understand completely your concerns, Blake, and I think that's why maybe the answer, as much as I don't want to say it, is what Lindy suggested is a meeting with the board, and not because, and I think the reason for that is because we've all looked at these plans and these edits so much that we start missing what we've changed here from there. So I think having everyone around the table, if that's our concern, then we can make sure that we don't have an issue where we've contradicted. Because my concern is if we come back next week and we have this same plan, we've eaten up another week that we just don't have in order to make a plan.
We need everyone at the table.
If I can interject, there's 2 fundamental things that we are not paying attention to, and it doesn't matter how many pieces of paper that we generate. And those 2 things have been front and center all evening long, and been front and center for the last 3 weeks since the admin were actually brought into the loop and started working on the plan. It's been in front and center for the last 5 or 7 days since the clinic staff were brought in to start looking at the plan. We can't cover the staffing. It doesn't matter what plan we come up with, we can't cover the staffing. We don't have the room to deal with the number of kids that we're gonna have with COVID symptoms. We haven't even looked at the building plan, so we don't even know what implementation of this looks like. I don't see how it's feasible in the next 4 weeks to put together a plan and to implement it and be ready. The obvious answer is staring us in the face, and none of us want to say it, well, except for Lucy. She started to say it. Our staff has been telling us this. Our admin has been telling us this. They've all been doing it politely to try not to stir up the waters too much. But we can't cover it. We can't implement this. It seems pretty obvious to me by inspection that we need to start off with 9 weeks of remote for everybody and give our administrative team the time to actually look at the detailed implementation of this. We get into a couple of weeks of remote learning, and then we have the opportunity where we can have these things in place to bring kids back in for 2 and 2, but do it in a ramp up manner and do it in a controlled manner. And that way we don't just drop everybody in and say, run like hell, guys, because that doesn't work. We're driving the bus towards cliff, and we're driving it really hard. And we got passengers along with us that are saying, folks, we got issues here. The wheels are falling off, and we're ignoring it.
Maybe I'm mistaken here. This learning plan does not include, we're starting on Plan C. This learning plan is just the adoption of plans. Option 1, Option 2, and the protocols, right?
It's a frame, you're right, Blake. It's a framework of saying, okay.
Mike.
It is on. It's a framework, and you're not agreeing to A, B, C, or D. It's a framework, and we need to keep it broad because we don't want to paint ourselves into a corner. Now, the building plans and the guidelines will be more specific, but this is just the overview. Okay?
I just want to clarify for Josh, because it sounded like he was saying we need to start on Plan D. This has nothing to do with Plan D. This is the overall plan.
This is the overall plan.
And that's what I want to make sure we're separating. This is the plan, not what plan we're starting with.
Correct.
Which is different.
This is just the overview, the overall plan that we're starting with. When you approve this plan, you're not approving where we start, okay? So if you approve the plan and we make those few adjustments, then you could do a item A1, and then make a motion of where you want to start. So you could approve the plan and then decide where you want to start.
Right, and that's what I wanted to clarify with Josh, because it sounded like he was confusing the two.
Right.
And that's, my issue is with the wordage of the plan, not where we start. If we want to make a motion to adopt this plan, and that helps.
That helps my
the words
staff.
of us saying this works, just fix those wordings.
Absolutely,
Then
and they
I'll
can-
make that motion. I'll make that motion if we can fix the wordage of those things, the overall plan.
I see what you're saying.
Here, yes.
I got you.
This, whatever you want to call it, overview, I'll make that motion to adopt this plan
With rights of revision.
with revisionary rights. I don't know how you say that.
with revisions requested.
With revisions requested. There we go.
Okay, I'll second it.
Do you want to clarify what revisions you want now, or is that list not complete?
I would say that list isn't complete, personally. But those 3, but I
I just want to make sure I'm getting the right motion and everybody knows exactly what we're
What we're
voting on.
voting
You can move, we are voting on this overall plan, not starting on A, B, C, D, E, F, G. This is the overall plan that we are putting together with revisions, definitely with those three, as pointed out tonight,
I
and
have marked
possibly more.
those three.
Yep, I've marked, yep.
The list of edits is not complete. I'll just throw that in. There are sections that are in the plan which we said we were going to comply with that are not in there. For example, student discipline. Nothing in the plan is in there, but that is in the guide that we are supposed to cover and reset and restart. There are others, so I'll just leave it as without going through the detailed list. These are the things we talked about a couple weeks ago and they haven't been implemented, so those are district-wide policies that need to be in this.
Okay, so Blake moved and Jay seconded to accept the reopening plan with revisions that are still yet to be determined. But it's my understanding there's
It
more
won't be
than just
three, yeah, there'll be,
Yeah.
leave it open.
Mr. Davis,
I feel strongly both ways.
I'm sorry?
Yes. I said I feel strongly both ways.
Oh, okay,
Yes.
okay. Mrs. Edis,
Yes.
Mr. Regan,
Yes.
Mr. Barnes,
Yes,
and Mr. Collins.
okay, so now,
Did he, wait,
oh, sorry. I keep forgetting you, Joss, I'm sorry.
Say again, Aaron, clearly for me. What are we voting on?
Blake made a motion and Jay seconded to accept the reopening plan with revisions, all of which are still to be determined.
Okay. I will go with the group and say yes.
Okay,
I'd like to make a motion that we open on Plan D.
Plan
I
D,
will second that.
D as in
Delta.
Delta,
Okay.
yes.
Okay, so this is a motion to begin the school, are you going to set a time frame on that, or just to start the school year?
Plan D, 9 weeks.
So the first 9 weeks of the school year will be started with Plan D, remote learning for all 5 days. Mr. Davis?
No.
Mr. Davis, oh, sorry. Mrs. Edis?
Yes.
Mr. Regan?
Yes.
Mr. Barnes?
No,
Mr. Collins?
I vote yes. Our staff are people we need to listen to. Our clinic staff are people we need to listen to. They're telling us it's too much, it's too fast. We need to start reserved. I think starting 9 weeks remotely gives them time to focus, gives them time with real direction. It gets us past moving day for OU and Labor Day. Gives us time to develop the plan. And I think I would ask that the board strongly urge, I don't think we need a vote or anything like that, but I think we need to see a detailed plan for how we do D at the next board meeting. We shelve option C for now. I would like to see how that works. And then I would like for us to consider, again, rather than just dropping everybody in and saying run, I'd like for us to consider in a few weeks, we start bringing back the highest need kids, the areas that we're ready the most for. And we do soft opens, and we roll them up. And we listen to our admin staff to tell us where that highest need is. We don't dictate it. We let our admin tell us. So I say yes to D, and I request that we start looking towards that.
okay, so B is still relevant, Aaron?
Yes, yeah, that has to be adopted
Okay.
for ODE.
All right, so it's recommended that the Board of Education adopt the resolution regarding the remote learning option.
Moved.
Second.
Mr. Davis. Mrs. Edis.
Yes.
Mr. Regan.
Yes.
Mr. Barnes.
Yes.
Mr. Collins.
Yes.
Yeah, this isn't actually adopting the remote learning plan. This is just authorizing the option for remote learning, and then they'll bring the plan to you.
Okay, we have the first reading. It's recommended that the Board of Education approve the following policies for inclusion into the policies and procedures manual, and it has to do with the use of face coverings. It's just a first reading. Item D, it's recommended that the Board of Education employ Jamie Lutz as a 5th grade teacher for the 2021 school year at step 21 on the teacher salary schedule pending her meeting all state and local requirements.
I move.
Okay. Mr. Davis? Yes. Mrs. Edis?
Yes.
Mr. Regan?
Yes.
Mr. Barnes?
Yes.
Mr. Collins?
Yes. Welcome back, Jamie.
All right, item E, it's recommended that the Board of Education accept the enclosed letter of resignation from Brad Jeffers as athletic director effective September 4th, 2020.
Second.
Mr. Davis? Yes. Mrs. Edis?
Yes.
Mr. Regan?
Yes.
Mr. Barnes?
Yes.
And Mr. Collins?
Yes.
Okay, any other public comments? Next regularly scheduled meeting is August 19th, 2020, at 7 p.m. And I'd have an entertain a motion to adjourn.
Second.
Mr. Davis? Yes. Mrs. Edis?
Yes.
Mr. Regan?
Yes.
Mr. Barnes?
Yes.
Mr. Collins?
Yes.